for public health is epidemiology. Semmelweis was using epidemiology when he found that the reason women were dying in childbirth was that they were getting infections from the doctors who were doing autopsies and then delivering babies without washing hands. Can you believe we did not have a department of epidemiology in this country till a little over 100 years ago? The U.S. Public Health Service started the first department of epidemiology at the Johns Hopkins School.
It was founded in 1916, right before the Spanish flu pandemic that circulated and killed millions of people around the world. And it trained a group of practitioners that would be able to fight that pandemic. It's gone on to make extraordinary contributions to public health.
There are epidemiologists and clinicians, public health practitioners all over the world who are looking to see what's happening in their communities and raising the alarm when something unusual happens. It's often doctors or nurses who report that a patient has different symptoms than they might expect. And by gathering that data in aggregate, we as epidemiologists can see what viruses are emerging.
In late December of 2019, I got the original reports of cases of severe respiratory disease and atypical pneumonia in Wuhan, China. The concern I heard in the voices of trusted international colleagues of mine that have been part of our community for a long time suggested to me this was something that we really needed to pay attention to. Healthcare worker deaths are red flags. People that are treating the cases coming in, if they're getting sick and dying and how quickly that's happening, tells you a lot about the nature of what the pathogen may be.
Early in an outbreak, speed is of essence. Days can matter, hours can matter. And so the quicker that you can make your insights widely available, the faster other people can use that to help to protect their own communities. Day after day, I saw that case counts were increasing. So the number of people with this infection were growing really quickly, and it really made me nervous. I could see that this was not coming under control quickly and that it was likely a problem that was going to spread beyond China.
In January of 2020, when the epidemic was growing exponentially, there were rumors that the Chinese would begin closing down Wuhan and then all of Hubei province, cutting off the transportation infrastructure. We had made the decision that there was enough seriousness to the nature of what was going on and concern and fear that we would go into our playbook for setting up an international arrival screening program at our airports to look for cases. We did not know fully what we were dealing with or the extent of exposure or contagion without really understanding or knowing the threat. How do you protect against introduction and spread in the United States? So in that setting, there were a lot of conversations about resurrecting 14th century toolboxes.
Public health has been protecting us since medieval times, since the Black Death. It was spread by fleas who carried Yersinia pestis, which causes the bubonic plague. And when it reached Europe through trade and travel, largely carried by rats, but could also be on fabrics, wool, other items that were traded, it caused terror, utter terror. 1 in 10 of a city is dying, up to sort of 2/3 of a city. It must have seemed like the end of the world. That kind of destruction is hard to imagine. In the late 1300s, in the Adriatic, in a town we now know as Dubrovnik, whose fortunes were built on trading with the East, they couldn't afford to lose the trade, but you can't have 2/3 of your population dying. What to do? And so the city elders of Dubrovnik came up with a solution that they thought would let them have their cake and eat it too, basically, which was quarantine. Make the ships stop at an island offshore and wait. And if anyone did fall ill, well, that's great, don't let them in. And if they didn't, well, great, it's safe. Quarantine was a public health tool. It was the city making visible its fight against this terrifying, invisible plague that no one really understood.
In Wuhan, China, the size of that quarantine was pretty unprecedented. Obviously, it did escape. Many people left the city before the quarantine could be enacted. So it didn't ultimately have an impact on preventing the pandemic.
The first case of the coronavirus has been reported here in the U.S. According to the CDC, the patient traveled in November to Wuhan, China. He's currently quarantined at a hospital just north of Seattle.
What's the emergency?
I can't breathe.
You're having difficulty breathing?
Yeah, I've got my oxygen on, but it's not doing too well.
She's feeling clammy and having chest pain, and she's getting shaky.
It feels like there's something on my chest. My arms and my hands are really tingly and cold. I cannot catch a breath. I can't catch my breath.
I understand. Are you alone right now?
Yes.
Thank you all for being here. I'm Dr. Anthony Chen. I'm Director of Health at the Tacoma-Pierce County Health Department. What I would like to announce today is that we have our first COVID-19 case in Pierce County. We might not have any magic bullets. We might not have a vaccine yet, but we do have a playbook. It might be an old playbook that has gone back for centuries, but it is a playbook that we know works. When there is no cure, when there is no vaccine, public health knows what to do.
Today I've come to talk about our nation's efforts to address this vital issue to the health and the safety of all Americans. I'm here to discuss our strategy to prevent and protect the American people from a possible outbreak.
After SARS in 2003, the Bush administration was very much gearing up for this concept of the potential of a new pandemic of influenza akin to the veracity of the 1918 pandemic. And there was, both at a global level and at a national level, a desire to have a really robust pandemic response plan.
The 1918 pandemic killed over 500,000 Americans and more than 20 million people across the globe. 1/3 of the U.S. population was infected. And life expectancy in our country was reduced by 13 years.
We wanted to chart the epidemic curve of deaths over a 6-month period during that 1918 wave in the fall, and then plot every day what every city did to mitigate that pandemic. We wanted time on one axis, the death count on another, and along that continuum, what were the interventions? First thing we noticed as we got the death curves together is that they looked fundamentally different. There were huge spikes like Philadelphia, and there were sort of rolling hills like St. Louis. When we looked at all the interventions, we could see that the shape of those curves were profoundly affected by the non-pharmaceutical interventions. Mask use, isolation, quarantine, business closures, school closures. We wanted to reduce the area under the curve, which is the cumulative number of deaths. And the delay was to buy time until we understood the virus better and until we could rapidly develop treatments and vaccines. What we saw in 1918 was no one thing in the NPI arena of non-pharmaceutical interventions was sufficient to give you the kind of protection that was needed. Multiple layers were beyond additive, they were actually synergistic. And that's essentially the Swiss cheese strategy. No one slice alone is sufficient, but as long as you had multiple slices of Swiss cheese and the holes weren't perfectly aligned, you created redundancy of protection. COVID has the ultimate invisibility cloak. People won't even know they're infected. They won't know when they became infected after exposure. And the only way to really curtail person-to-person spread and get ahead of what exponential growth would look like is to have a contact quarantine program. But I think the reality of implementing large-scale mass quarantine and isolation for a highly contagious respiratory pathogen that had reproductive rates with exponential growth and the potential of asymptomatic transmission, in many ways that completely blew away even the best laid plans.
Tonight, elected officials taking unprecedented measures to keep people safe.
Two of the nation's biggest states ordering all non-essential workers to stay
Closing down bars
home.
and restaurants,
social distancing. That includes shutting down things nationwide if the numbers start accelerating.
We had our playbook, but before the pandemic, we never had to implement it. You notice quite unusually, we are a little bit further apart than we normally are, and that is intentional. I mean, things like social distancing and stuff, we were talking theoretically that, yeah, that would be weird. Kids would have to sit 6 feet apart. We never did that before, but we had talked about it. So I think we were ready. But were we ready for the full scope of it? No. The infrastructure has been just kind of hollowed out.
Everybody loves public health, but we don't seem to like to fund it.
Due to local budget restrictions, we were forced to close our clinic.
We don't have any communicable disease staff.
We have a problem in public health. We only fund when there's an emergency.
The investigators at the FBI are just very carefully exploring all the information they have about the anthrax attack on the country.
After an incident, whether it's the anthrax attacks in 2001, SARS in 2003, H1N1, Ebola, Zika, on, there is a surge of interest and sometimes funding in bolstering public health. And then very quickly, that energy and investment fades.
This is part of the panic neglect cycle, that in the middle of a crisis, attention and care and investments flood into addressing the problem. And at some point, all of that starts fading. We start shifting towards this kind of cultural amnesia, and it returns us to the same state of unpreparedness.
That is not how we manage national security. It's not how we manage the weather service. The Hurricane Center does not shut down when there is not a hurricane.
I was in the government after the anthrax attacks and H1.
During that economic recession, we lost tens of thousands of public health personnel across the country. Tens of thousands. And they're gone. When you lose an epidemiologist or you lose a public health nurse, it's a specialized skill set. Those people move on.
We've had this workforce that has been underfunded and understaffed for a long time. And when we needed to actually pull that pandemic playbook out, we found that a lot of the players weren't there. And those folks who were still there, those who were on the field, they threw everything they had at COVID. We just didn't give them enough to throw.
The public health professionals in our communities are truly the first line of defense. They are trying to prevent the community from ever needing to encounter emergency departments, hospitals. Those are the systems that are under strain right now and under stress right now.
Can I get an attending up to the front waiting room for a rapid triage?
Let's get a stretcher, restraints, meds.
Because of COVID, we found out just instantly how one entire city or state or wherever can be overwhelmed.
Gentleman who fell 50 feet off of a ladder.
About 60% of our work is focused on patients who are having direct impacts from COVID, but 40% is for people who have a heart attack or get a bad infection, get sepsis, but who can't get access to the care that they need without somebody blocking in front of them. America's healthcare system is fundamentally designed to meet the needs of diseases when they happen. And yet, if you peel back the layers, you realize, oh my, the public health infrastructure in our country has really been one of the key reasons why America has been allowed to flourish, I think. They are the ones who really are focused on preventing disease and mitigating disease before it gets to the point of needing to be in the hospital.
When I was in a hospital or a clinic as an ER doc, I was super focused on the individual in front of me, my patient's blood pressure, my patient's immunization status. So many patients would come in multiple times, and it was particularly around chronic health, diabetes, high blood pressure, salt-related for heart failure, and they would come back. And I would treat it. They would come back. I would treat. They'd come back. I'd treat. They'd come back. I felt powerless as a physician to care for them because I didn't have time. I had to go to the next patient. In public health, the community is our patient. The health and well-being, the safety and security of that overall patient, that's what we focus on.
I remember driving to work one day, it's your normal, busy, crazy day, knowing that I was going to have to say something to people to explain that these highways would be empty, just like we had seen, around the world. And what are the words you use? What are the things you're going to say? There's no playbook for that. You do feel 11.7 million people. And the feeling I had was, how do I get every single one of them up on this life raft? And nothing I would do orders-wise was going to do that. What we really knew was it was behavior. It was what we were all going to do collectively. We were teaching Ohioans what to do. We taught the metaphors, the Swiss cheese analogy. We did nothing. Again, I'll refer you to the UK study by Ferguson. We would see that very more scary, sharp, steep climb. We have these things like social distancing and mask wearing and washing your hands, that when you layer them, what you got was almost near vaccine-like effect. And people rallied. And it was a beautiful thing to see.
I pledge allegiance to the flag of the United States of America, under God, indivisible.
I think it brings the neighborhood together, brings us together safely from a distance.
This is no small thing that we are doing together. It is so incredibly hard to have shut down our lives the way we have. I am absolutely certain you will look back and know that you helped save each other. There was probably a good 6 weeks of folks rowing together before things became overtly political.
We are essential! We are essential! We are essential!
It is getting increasingly hard to give you numbers that are accurate because it's pouring in so quickly. We are looking at what the scientists know, what we're seeing happening in other countries, what the best data and studies are, and we're predicting.
One of the most common kinds of activities that we do in outbreak science is forecasting. So we can actually look ahead and say, what do we think will happen with this outbreak in 2 weeks or 3 weeks? And what do we need to do now to be prepared for that eventuality? And that's important for decision makers.
It is important that we minimize our physical connectivity. COVID has turned me into a data addict. There's this sort of routine, which is that every afternoon I get the number of infections in my state, the number of hospitalizations, the number of deaths in each individual county. But we also look for national data to see if there's any breakthrough viruses appearing anywhere. And it has guided our decision making, and I think it's one of the reasons we've been successful. Tonight, I am extending our state's Stay Home, Stay Healthy initiative for an additional month. When you make decisions on data and respond to the changes in data, that creates some frustration for citizens.
I'm defying the governor's order. All business is essential to someone. I don't think our governor thinks that.
From a public health or scientific perspective, the reasons that policies change or recommendations change, it's usually because we have new data coming in and we see that as science or progress. The public does not see that as science or progress. They see that as the public health entity doesn't know what they're doing.
Looking back on that period, I remember thinking that the entire population is getting a kind of a real-time, first-hand experience of watching the scientific method in practice.
How long can COVID-19 survive on a surface?
The CDC, NIH, UCLA, and Princeton released a study that said the virus can live for hours on copper and cardboard and up to 2 to 3 days on plastic and stainless steel.
One of the things that you learn if you spend some time around the scientific method is it's messy.
The CDC now says the coronavirus does not easily spread by touching surfaces.
Release statements were later brought out as evidence that the public health authorities, had conflicting messages. And it's like, well, they did have conflicting messages on some level because they were learning on the fly.
You are the 18th director of the Center for Disease Control and Prevention. Should people be afraid?
No.
Should you wear a mask if you're healthy?
No.
I did become frustrated with the fact that the White House was dictating not only what CDC would say, but what was on the CDC website.
We now know from recent studies that a significant portion of individuals with coronavirus lack symptoms. In light of this new evidence, CDC recommends and the task force recommends wearing cloth face coverings in public settings.
This is voluntary. I don't think I'm going to be doing it.
You couldn't even end a press conference knowing what the truth was. They were not protecting the population. They were not helping public health. They were giving public health a bad name. You didn't know who to believe. The whole idea of trying to improve on what you've learned in the past, well, in the past, this always would have been approached with some sort of a national plan. There was no national plan. It was, okay, states, you're in this alone. Compete with each other.
There were many messaging challenges throughout COVID, a lack of consistency, a lack of clarity. But what really hurt was that the President of the United States framed this whole response as lives versus livelihood. And that ended it. All of a sudden now, any public health intervention, masks or vaccination, it was about taking away your freedom.
One of the things that came up a lot in the early days of COVID-19 was the fear that medical professionals were sort of intervening in everyday life and trying to shape the things that we could or could not do. You couldn't go shopping. You had to go to grocery stores at certain times of day. The government is making sure you were wearing a mask or making sure that you stayed at home. People had a fear that these kinds of things were just a harbinger of something worse yet to come.
Essentially, every school district across the state is starting out this fall with distance learning, but in Pierce County, it's not a choice.
It is the only county where local health officials are actually making an online start mandatory.
We were flabbergasted. We did not think that the Tacoma Pierce County Health Department had the right to do that.
They've acted on their frustration and filed a lawsuit against the Tacoma Pierce County Health Department.
Here we had a health department come down and say, no, we're going to make the decision for everyone, and they cannot legally do that.
But Pierce's health department says Dr. Chen does have the authority to make that call and did so using the state's guidance.
We've had to make all kinds of difficult decisions. I've got a great crew of folks here, and now, people are tired, and you can't just run on adrenaline anymore. Pierce County's rates are up dramatically. No one thing appears to be driving up the numbers. We're just seeing more cases. Any place that people are where they're not wearing masks, maintaining physical distance. I worry about my mother. She's been hospitalized 3 times this year already. My father's in his mid-90s, and a COVID-19 infection would kill them. With this third surge, we must recommit to wear masks, limit travel and gatherings, and keep physically distanced so that we can make progress and keep what's important for us. We've seen COVID fatigue. I mean, even for me, it's like I connect with our county exec every day, give him the numbers. It's like, oh yeah, another 300 cases. Heck, back in June, we were 10 cases a day. 300 cases a day now. It's like, shrug our shoulders, right? Even we are getting numb to it. But we've got to keep the conversations going. We need to find the right message. But is the public willing to listen if they're confused about public health?
It's really hard to describe the public health system. Who's in charge? It's not the CDC, no matter how much people might want to think it. They don't have authority to go into a state and tell that state what to do.
The CDC gathers data from all of the state health departments, and they will bring that data together into reports. They also turn that data into guidance. But public health authority actually lies at the state level.
This is one that the founding fathers got wrong. They put the control of the public health system with the states. And that means we don't have one public health system. We have 50. If you count localities, it's now in the thousands.
Some states have a Secretary of Health, and some states have very specific departments which interact with local health departments. Each local health department has its own code. Often it's funded differently. So you could say, I would like to have a public health system.
Not every state has its own army or its own navy. Could you imagine? We would have already been taken over by a foreign nation if that was the case. But when it comes to public health, everyone's doing it themselves. One state is trying to hire contact tracers while another state is opening up bars and restaurants. It's an orchestra with a lot of conductors and very few instruments.
This has been a tough week, and we are seeing a lot of deaths here in Ohio. We also are seeing a lot of confusing messages out in the media, and I want to say to you, Ohioans, stay strong, keep doing the right thing. I don't know if you can hear through the television, but there are people protesting right now outside the State House, and people are worried.
Open Ohio!
I have people in my family who have businesses. Like, people were facing tremendous hardship. So there are people legitimately protesting and worried and concerned. My first instinct always is to go talk to people. But I couldn't go out of doors because they had guns.
This has been a very difficult time for people in the field of public health who suddenly have been in the harsh glare of a spotlight that they did not ask for, and that has been unfortunately skewed by the polarizing politics that we have in this country.
That speaks to the other question I asked last night. I know it was like 1:32 in the morning. Sorry about that. It was a little bit of insomnia going on.
Those politics will affect the response to the pandemic. And we're already seeing, unfortunately, in some states that the lesson people are drawing from COVID-19 is we need to have a weaker public health system with fewer powers to protect people in the case of an emergency. It's a huge mistake.
Ohioans did such an amazing job collectively of helping flatten the curve that we didn't see the worst of the impact that we might have seen on our hospitals. Unfortunately, that also led to people saying that it's not true. Eventually, the legislature was doing acts to impeach my ability to do work. You almost had the feeling that there was an intentional attempt to discredit public health leaders.
This week, Dr. Acton told me
that she feels it is time for her to step down as our Director of Health. Her wise advice and counsel have truly been invaluable.
The hard part of my job is that when I knock it out of the park, you don't see what I've done. I've prevented something. You actually can't see what it is we prevented.
There's a real science to this. We are actually professionals. We train to know what to do when there are outbreaks, and we should listen to those people.
Today, I'm issuing an executive order that outlines how we go about opening the Texas economy. To guide this effort, I have formed a statewide strike force to open Texas.
You don't want a politician in your clinic telling you what to do with your health. If you had cancer, you're not turning to a congressperson to figure out how to treat it. That's a decision between you and your doctor. But when it comes to public health, everyone seems to know how to do it, and we debate it instead of following what the science tells us.
Now, within the last hour, as you had mentioned, Texas Governor Greg Abbott announced the state will now pause its additional reopening phases after health officials in his state reported over 4,300 new hospitalizations of COVID patients yesterday, a record high for the 13th straight day.
We were in a political environment that, frankly, I think cost lives. Now, those decisions cannot be considered in just a 4-year term. It's the legacy of decades of underinvestment, which led to where we are today as a nation. And we should have done better, but we didn't. And that's something we're going to always have to live with.
It looks like now we definitely have an increasing trend in deaths. In, early September, we were kind of around 5 deaths being reported per day. Now we're closer to probably having 12 deaths reported per day.
I'm basically working 7 days. Sunday evening, 8 p.m., and I'm working the phones. The CEOs of the hospitals, the chief medical officers, the mayor.
Do you anticipate that our numbers could go right back up tomorrow? You caught up to the lag in results?
Yeah, so right now, it's not clear to me the numbers actually down. I'm helping them make decisions. They're consulting with me. And at the same time, I'm trying to do my regular job. But my staff, they say to me, you need to take some time off over the holidays, right? I took 10 days off. I was in the car. My wife was driving towards Buckley and Enumclaw to go to a waterfall out there. I was on my laptop trying to wrap up something that I needed to do. And I saw the email pop up from one of our board members that said, I just heard the council chair is going to drop this bill, which, dissolves the health department. And this was timed just so that they could vote on it in the last meeting of the year, which would be the last meeting that there would be a Republican majority, because the elections had shown that the council was going to flip. And so come January, they would lose the majority.
Under the system of the county council, being the board, every citizen will have equal access. It's much better for open government, which is something I have fostered over the last 30 years.
Science is subjugated to a political agenda in this nation. And until we can separate those, then we're always going to have politicians who are going to run for re-election prioritizing their winning over the lives of their constituents.
The Pierce County Council is set to address this at their next meeting on the 7th. I did ask both Councilmember Roach and Dr. Chen if they've had a chance to speak with each other since this news came out, to which both of them said no.
We believe in the strength and value of an independent health department. I've been here over a decade. I knew I could get fired anytime, but I didn't care. I was trying to do what I thought was right in a public health way and took a harder line than some of my peers throughout the state. It is just unfair to be doing something where my staff who are working incredibly hard are wondering, are they going to have a job tomorrow because the county council is going to disband the health department? We knew that people have thought about this. It was a real surprise to us that people would want to bring it up in the middle of a pandemic. I mean, it just boggled my mind. I mean, but that's politics, right?
Case counts show we are likely heading into the darkest hours of this pandemic, but the Pierce County Council member behind the move apparently wants the county to have more say in how public health is handled and want to make that change right now.
It means, in fact, we have a different governing body, and I think that's a good thing.
There's not a single suggestion of how it would improve health outcomes for the people that live in Pierce County.
Right now is not the time to change. We need to be focusing on saving lives.
At this time of the great unveiling of the weaknesses in our system, in this very moment when we see that things aren't working, is the exact moment we have a tremendous opportunity. We could do so much better in this country.
If the county council passes the ordinance, the current health agency would be dissolved by the end of next year.
If one person dies because of this decision, you will have blood on your hands.
We now have seen real time what happens when you ignore public health. A lot of people are going to die.
We currently do not have the ability to properly report COVID-19 data.
If you're missing data, then you miss whether or not there are pockets of illness that need special attention.
The most important point in public health history was 1854. Something was killing people.
Cholera, it's horrifying.
It was the first time an actual intervention had been made based on data.
The promise of better information is what can unlock our health.
I just can't ever accept body bags for our people.
There's a lot of fears around AI. AI is not technologically neutral, right? The splitting of the atom is not technologically neutral. There's implications.
Hi, Toma. Hey there, Emily. You have machines that say, I love you. I care about you. I'm your friend.
I'm a human, not an AI. You can't just shut me down. Who do you think you are?
I'm Emily Chang. Welcome to Posthuman.
I think that it would be irresponsible for us to ignore the AI revolution. I think that as much as there is a lot of short-term hype. I think long-term it has the potential to be transformative. And so we are spending a lot of time thinking about what elements of it are structurally have barriers to entry. And so there is a winner-take-all element to that and which don't. And it seems to me that things like chips, things like infrastructure and systems has a little bit of that because NVIDIA is so far ahead, it's expensive to catch up. There's, the technology that it requires to build these chips are sort of based in Taiwan. What we're seeing is that some of the apps and some of the applications, there are no barriers to entry, right? Like it's fairly easy to come up with, and I don't mean to belittle the complexity of it, but there are not moats around those things like they used to. So I think that there is less of a winner take all in that space. You're going to have to earn that spot. Whereas, it'll be fun to watch what happens. And I think there's going to be a lot of money burned in the process because somebody will develop something and a fast follower will come along and make it better and cheaper because data gets cheaper and more pervasive. And it's going to be easy for new players to come in and do interesting things. So I think we wait and we see.
The top names at the Fed are on Bloomberg.
The economy's in a very good place right now. Inflation's coming back down to target. The labor markets are healthy. We're seeing solid growth. I think we're well positioned. I certainly wouldn't take another ease in December off the table. But again, we're not on a preset path. And so we'll have to look carefully at the data and see what makes sense when we get to December 18th.
Nobody covers the Fed like Bloomberg.
We felt strongly that there has been an opportunity for there to be an experience on mobile that is centered around gamers. Like we talk a lot about how there's 3 billion gamers in the world. 2 of those billion play on mobile, and half of those actually play on mobile and they play on another device. But there isn't actually a gaming platform and store experience that is centered around players and goes truly across device, where who you are, your library, your identity, your rewards, that travels with you versus being locked to a single ecosystem. And we've recognized that opportunity for a long time, but we wanted to make sure that anything we built was really grounded in people who play those mobile native games and the creators of them. And so being joined with a team that has real deep expertise in mobile was important to us.
Morning, this is Bloomberg Daybreak Europe. I'm Tom McKenzie in London. These are the stories that set your agenda.
Taking you from the U.S. market's close to the overnight session in Asia. We'll walk you through what you need to know to kickstart the European trading day. Live from our European headquarters, we bring you the day's top market-moving stories, unmatched expert analysis, and on-the-ground reporting from across the continent. Tune in to Daybreak Europe, only on Bloomberg Television. Context changes everything. Bloomberg Surveillance covers the latest in global markets and the political events that influence your world. Join Jonathan Farrell, Lisa Abramowitz, and Anne-Marie Hordern only on Bloomberg. Context changes everything. The top names in business are on Bloomberg.
The IRA was I think a legislation that was focused on carbon intensity, the right way to drive emissions reductions, and so we responded to that to demonstrate there are ways to continue to provide affordable energy and reduce emissions. How quickly do we want to advance those? Obviously, we need the regulations to come out of the administration. Even the Biden administration today hasn't fully translated the IRA into effective regulation.
Nobody covers business like Bloomberg.
Battling a new pathogen is like a chess game. There's the opening when the virus first emerges and very little is known.
The first case of the coronavirus has been reported here in the U.S. He's currently quarantined at a hospital just north of Seattle.
And then there's the long middle game where you're using public health and social measures to try to shape the way the board will unfold.
In the early days of a public health crisis, one of the most important resources we have at our disposal protecting us is data.
I am calling in regards to your most recent COVID test. If you can think back, when did you first start to feel sick?
Collecting data and analyzing it, making sense of it, and disseminating it has probably saved as many lives as the vaccines and the antibiotics.
Today, I'm announcing a 2-week pause on our phased reopening plan. This decision is based on the information that we've been able to analyze just in the last few days.
The problem is, the data is not some completely empirical portrait of reality. It's always evolving over time.
There was this big debate about whether kids should be in school or they should be learning remotely.
Essentially, every school district across the state is starting out this fall with distance learning, but in Pierce County, it's not a choice.
It is the only county where local health officials are actually making an online start mandatory.
When I tell the schools that they have to close down, then I get hate mail from people saying, "You're killing my kids."
When you make decisions on data and respond to the changes in data, that creates some frustration for citizens.
Pierce County Council is actually considering breaking up that local health department.
It means, in fact, we have a different governing body, and I think that's a good thing.
Case counts show we are likely heading into the darkest hours of this pandemic.
If there was a problem, why wasn't anything brought up to the health department?
We're tired.
Why did this come out of nowhere?
It makes no sense.
I rely on information from the health department to help me make decisions on how to run my general contracting
If
business.
one person dies because of this decision, you will have blood on your hands.
Quickly highlight a proclamation I signed today that is intending to protect the hard and vital work we're doing now in our local health districts. This proclamation puts a pause in effect on efforts to terminate a health district or a city-county health department, such as what is currently taking place in Pierce County.
Breaking news tonight, an ordinance to disband the Pierce County Health Department fails to pass the county council.
I cannot be a party to having any kind of action taken on this matter. I believe that it places the county at risk of criminal action against us.
Several hours of public comments on the topic overwhelmingly oppose the ordinance.
If you move forward with this ordinance, you will show yourself to be absolutely corrupt and undemocratic fools.
In a surprising move, the specific council member who tipped the vote was the ordinance sponsor, Pam Roach.
Yes, Councilmember Roach?
No.
What? Wait a minute.
And as you heard there, a big surprise coming from her no vote.
All right. Yes, great news.
This pause will allow public health workers to focus their energies on the most challenging chapter yet of our pandemic. Unfortunately, COVID was made into a partisan effort. That hurt us dramatically. There are heroes beyond counting in the COVID epidemic. These public health officials have made decisions to save lives and keep people healthy, even in the face of criticism. You can restore your economy. You can rebuild your business. Once life is lost, there's no coming back. So we made decisions that we thought that would actually save lives.
Attention employers, masks are required by federal law.
And I have felt very steady confidence that they were made based on clear science.
The idea of using data to improve health outcomes on a society-wide level emerged in the 19th century out of a number of different converging forces. Industrialization was happening so fast in England and parts of Europe and the United States, and urbanization was happening so fast. London grew from less than 1 million people to 2.5 million people in a shockingly short amount of time. Those changes were so dramatic that they had disastrous health outcomes.
This is total disruption that public health, not as a formal profession, but as a field, had to respond to.
More than anyone in that period, the guy named William Farr advanced the science of what was then called vital statistics, eventually became known as epidemiology. And he turned it into really kind of an art and a science. He built what were called life tables, and he commissioned one extraordinary triptych of 3 different communities: British countryside, London itself, the metropolis, and then Liverpool, which was next to Manchester, probably the most industrialized new city in that period. What you saw when you looked at this visualization was just a scandalous, shocking, tragic gap. People in the countryside were actually living close to 50 years on average, whereas in Liverpool, average life expectancy was somewhere around 25, maybe some of the lowest average life expectancies in a community that large ever recorded. By assembling that data, he was able to prove that something was killing people in these large new communities. The tragedy of that news actually made it possible to imagine a positive outcome. Like, if you can organize society in such a way to cause people to die at an accelerating rate, maybe you could make changes to society to actually reverse that and improve things.
These ideas led to the creation of sanitation departments, housing reforms. Public health became a field that was dynamic in its conception of what health was.
And that involves everything from infrastructure spending to data collection.
All sorts of groups began to try to figure out how we could have a new industrial society that didn't create enormous gaps in suffering. So it wasn't like a profession that just looked through a microscope.
In the fight against disease from a public health standpoint, it is fundamentally important to know when, where, in what numbers, and under what conditions various diseases are occurring.
We have now entered into the digital age. We have the ability to now look at large quantities of data and make assumptions about the public health.
In February of 2020, we started hearing from local jurisdictions of excess mortality among African Americans. And it turned out that that excess wouldn't be limited only to African Americans. We've seen it among indigenous people. We've seen it among the Latinx population. And these were not small gaps. These were big ones with 2-3-fold higher mortality risk. And they were driven by the fact that people tend to be less healthy if they're African American as compared to white, so that if you got COVID, you might be in bigger trouble for a bad outcome.
One way to see the broad scope of public health is looking through the lens of the pandemic, actually. You can see how all of the inequities and health issues that people face from day to day that are not related to infectious disease have really put people at risk for severe COVID-19.
Anybody who has what we call comorbid disease, diabetes, hypertension, heart disease, is more susceptible to this disease, and it tends to be more lethal.
Those patterns of diseases are racially and socially patterned. Groups with lower socioeconomic status are more likely to have greater burden of disease.
Poverty is a public health issue. Poverty is a pathology. When people live in poverty, it means that they die earlier. It means that they get more cardiovascular disease and cancer. Their kids get more asthma.
Communities of color tend to have higher concentrations of small particulate matter that lead to lung disease, to heart disease, to cancer, to low birth weight infants.
That greater burden of disease, coupled with COVID, made those groups more likely then to have death from COVID.
If people are able to live healthy lives, they have been much less affected by the SARS-CoV-2 virus. And so it's about having people be able to lead healthy lives without disease that actually contributes to our success in controlling infectious diseases.
Not every challenge can be addressed by a vaccine or medication. Sometimes it's improving access to healthy foods, managing housing so that housing is safe, having a safe place to exercise so that you can stay healthy. When you think about what's considered to be the most important point in public health history, you go back to 1854, to London.
1854, London. It was horrible to be alive and a member of the working class in an industrial city in the middle of the 19th century. There was tremendous poverty, tremendous problems with industrial pollution, childhood mortality rates like 40%, 45%. So almost half of your kids would die before reaching adulthood. Maybe the most noticeable thing when you visited London in the 19th century was just how smelly it was. People did not have toilets attached to modern sewer systems, and so there were cesspools in people's basements where they would just throw away their feces, and then you would have these people called the night soil men who would come and collect the human excrement and dump it into the river. And you had livestock adding to the smells, not just the horses, but people would keep cows in their attics for milk and things like that, and then you had industrial pollutants everywhere. So the city was an extremely unhealthy place to be. And in some ways, that environment, particularly the smells, led in a way to one of the great mistakes in medical history. Cholera was one of the biggest killers of the 19th century. It induced radical dehydration through terrible diarrhea. People would just waste away. Over just 48 hours or 72 hours, you could go from being perfectly healthy to being dead, and you would be psychologically fully aware of it until the very end.
There's stories going around during the outbreaks of cholera in the 19th century that a husband would go off to work and then he would never come back. And the family would find out, well, he just collapsed in the street in front of everybody in a kind of pool of diarrhea. You know, it's horrifying.
At the time, people were under the impression that cholera was actually caused by something in the air.
So the paradigm was that diseases that were contagious were spread through the air, through miasmas.
It was a reasonable assumption to make, the miasma theory of disease, of all smell is disease. There was an early public health sanitary battle to remove the smells from the city. In 1848, there was this act that was passed called the Nuisances Act.
There was a big movement to start installing these new water closets, these flush toilets that would wash away not just the contents, but the smells of human waste out of your home, out of your alleyways. They just dumped all that stuff right into the river.
Into the Thames. Of course, the Thames was the primary supply of drinking water for the entire city. A modern-day bioterrorist could not have come up with a better scheme for poisoning the city. In fact, cholera got worse after this intervention.
That idea that cholera was something that you could drink was contrary to the paradigm of how contagions were thought to spread at that time. What happened when this new disease came along is that we applied our old way of thinking to it.
You would see these cholera outbreaks where, 10,000 people would die over the course of a few weeks. And in the middle of all this is Dr. John Snow. He was trained as a physician, came to London, began working in Soho, which was one of the poorest neighborhoods in all of London. He was one of the first people to realize the importance of anesthesia, ether and chloroform, these gases that would relieve people of pain or cause them to go to sleep, and you could then perform surgeries on them. Snow had always felt that the miasma theory was wrong.
He was an anesthetist, so he knew how inhalations worked. He knew how gases moved around. And you could see, look, this isn't something that you inhale, because if you inhaled it, it would make you sick in your lungs or your respiratory system. Cholera made you sick in your gut.
At some point, early in his research, he began to suspect that cholera was in the water. He was trying to identify the organism that was causing the outbreak itself. I mean, he had microscopes. He was looking for it, but the limitations of the lenses of the period prevented him from doing that. but he was thinking on the microscopic scale. He was also thinking about the scale of the human body. He was also thinking about it on a neighborhood level. And he was thinking on the scale of the city itself. He worked on it for years. And he actually built up quite convincing evidence to show that cholera seemed to be related to the question of where you got your water. And no one really came around to his theory until an outbreak erupted literally on his doorstep in the late summer of 1854. In a poor neighborhood like Soho, most people would get their water from these public wells. There'd be a pump, and people would go with a couple of buckets, and they would collect water for the day or for the week. And it happened there was a very popular pump right across from 40 Broad Street in the heart of Soho. At some point, the well water became contaminated with the bacterium that causes cholera. And this central watering hole for the entire neighborhood became a vector of death. And within a few days, the single most concentrated and terrifying outbreak of cholera in England's history erupted in Soho. And over the course of the next 3 or 4 weeks, 10% of the neighborhood was dead. With an outbreak that concentrated, John Snow thinks there must be one source of water that is contaminated, and if he can find that source, maybe he can finally convince the world that his theory about cholera's origins is correct. Snow steps out into his community and starts knocking on doors, asking people, has anyone died here? Has anyone gotten sick here? And where did you get your water? But he also relies on public data that had been accumulated by William Farr. Everywhere he looks, if someone has gotten sick as part of this outbreak, they had some direct connection to the well water at 40 Broad Street. And based on that information, he starts to build a case for why the pump should be shut down. And ultimately, Snow decided to represent all of the data that he and Farr had collected as a map. It was a bird's eye view street map of the neighborhood with a little circle marking the well at 40 Broad Street. For each death at each address, he put a little black bar corresponding to that death. Because it was so concentrated, because it was so terrible, it enabled Snow to represent to other people this pattern that explained what was causing the death in the first place. Snow presented his case to the local Board of Health, and the pump handle was removed. Within a few weeks, the outbreak was over. It was one of the first cases where an actual intervention had been made by the authorities based on data. And that led to a whole series of interventions to make communities safer over time. After the 1854 outbreak, a number of major infrastructure changes were put in place to clean up the water supply for the city. The most formidable of them all was the creation of the London sewers, and really one of the most extraordinary engineering achievements of the 19th century. A massive project actually completed in a remarkably short amount of time, really about 5 or 6 years. In 1866, an outbreak appeared in the East End of London. John Snow had died about 7 or 8 years before that, but William Farr immediately treated it as a problem of contamination from drinking water. He began investigating it, and in a way, you can see that as the moment where the modern system of public health, of collaboration across disciplines, from state institutions to infrastructure to individual medical practitioners reporting data, all of those things converged to stop this outbreak of cholera in 1866. And that was the last time that cholera has appeared in London ever since. It's not something that doctors did. It's not something that the hospitals did. It's something that, foremen did and bricklayers did and civil engineers did. You can see the icons of progress in the skyscrapers in some of the largest cities in the world. But the developments that actually keep the citizens alive and healthy and living much longer lives than their 19th century equivalents would have, those achievements are all below ground.
That's what makes public health so powerful, that it's not just about imploring individuals to do the right thing for their health, but putting in place structures that mean that you get to be healthy without making a personal decision. You get to drink clean water, breathe breathable air, eat healthy food. These aren't personal choices. These are protections that are made for all of us.
We've prospered because of public health. It's what allowed us to build our cities. It allowed us to have safe workplaces. It's allowed us to really live longer lives.
One of the great breakthroughs in the history of public health and of medicine was the bacteriological revolution, in which we began to identify specific germs that were identified with what we call diseases. The sanitary idea of health had been extraordinarily victorious. Tuberculosis rates were already declining tremendously. Typhoid was declining, cholera was declining, because we had put in the water systems and the air systems. What it did was, in some sense, undercut older notions of diseases being broadly located in the environment in which people lived. So public health departments increasingly turned to the lab. We had narrowed our vision of what public health was so that we began thinking of public health as a biological problem, which we had to use curative medicine to limit disease.
Medicine is a social science, and our risk of disease depends on things like poverty, lack of education, hazardous working conditions, political malfeasance, all of these social factors that we now don't really think of as part of the disease equation. We don't think of these factors because of the rise of germ theory. This biomedical paradigm has influenced how we think about disease for the better part of a century. It's why, when COVID arrived, so much focus went into things like developing vaccines or developing antivirals, and very little focus was paid to the social conditions that allowed the virus to spread.
As we look at this COVID-19 pandemic, we knew that communities of color had more heart disease, lung disease, kidney disease. Those chronic diseases put them even more at risk of getting really sick once they got infected. The tragedy we had here is that our public health system had been weakened to such a degree that we weren't able to get our hands around it.
I think coming out of the pandemic, we now have seen real time what happens when you ignore public health. A lot of people are going to die.
In the next minutes to hours to days, we're likely to see 1 million deaths reported in the United States from COVID. This is 1 million reported deaths. Of course, this is not necessarily the number of actual deaths that we know have happened. That's actually greater. But we are currently at 999,741 recorded COVID deaths in the U.S.
It's just been an incalculable loss. These numbers are so big that it's hard to put a personal story behind each of them. And it's really important that we remember that each one of those deaths has a story that goes with it. We can't get numb by statistics, but that is a risk.
One day, 3,900 cases, and that's 3,900 people. Right? That's a human being, that's a family, that's a neighbor, it's a coworker, it's a neighborhood, it's a community member. Heck, it could be you.
It has been, quite frankly, a harrowing time. What's, I think, more troubling to me, though, is how many people may have passed away that we may not actually be able to account for.
It is a chilling sight, a mass grave, rows of coffins as burials quadruple in New York.
I don't even think we have an accurate estimate as to how many people we've actually lost in communities of color. The need for infrastructure and public health includes the need for us to do a better job of data collection so we actually know what's happening in communities. If we can't measure it, we really can't manage it. We need better health surveillance data in this country.
If you're missing data, then you miss whether or not there are pockets of illness and suffering that need special attention. It is absolutely essential to understand the distribution of health problems and where they are the greatest in order to be able to fix problems. We are only as strong as a society as our weakest link.
As we look back over the whole span of the COVID pandemic, the group that had the worst hit on life expectancy was a group classified as American Indian Alaska Natives. Their life expectancy is now set at about 65 years, which is only met in our part of the world by Haiti, an incredibly troubled and poor country.
Turn to Ms. Echohawk.
Thank you so much, Madam Chair. My name is Abigail Echohawk. I'm a citizen of the Pawnee Nation of Oklahoma, and I currently serve as the director of the Urban Indian Health Institute, one of 12 tribal epidemiology centers located across the country. In addition, I serve as the executive vice president of the Seattle Indian Health Board.
I come from a tribal people who, at one point in time in 1910, there was less than 600 of us.
I want to start my testimony with a story. Seattle was the epicenter of COVID-19 in February of 2020. We quickly ran short of PPE. We sent out requests to our state, our federal, and our county partners. Soon we received a box at our clinic, and the CEO and myself opened up that box expecting to see gowns, masks, and the PPE that our providers need. Instead, what we found was a box of body bags. We had been sent a box of body bags instead of the PPE that we had requested. While this was a very literal example of Indian healthcare funding and the way that we have been treated in this United States that has created the health disparities that currently exist for my people, it is also a metaphor for the way that many tribal nations experience getting resources for the COVID-19 response early in the pandemic.
The cumulative incidence of COVID-19 among urban American Indians is 2.03 times greater than among non-Hispanic whites. I would say one of the big drawbacks of this data is that only 46.4% of cases are arriving with race and ethnicity listed.
Yeah. I really suspect that where the difference is greater for whites than it is for Indians, I suspect that that's not correct.
Aren't we missing Oklahoma and one of the Dakotas?
Yeah. They're two of the only states that are not reporting race and ethnicity.
The calls that I've been on recently, I just was on one that was almost all county administrators, and a lot of them were saying, hey, we have this data and we've been reporting it, and it's not our fault that the states aren't sending it correctly to the CDC. We need to look at the overall American Indian Alaska Native population in North Dakota and Oklahoma. I mean, Oklahoma has some of the largest number of tribes of any other state as it was the Indian territories, and they're not reporting.
As a result of the crumbling infrastructure of public health surveillance systems, we currently do not have the ability for both the states and the CDC to properly report COVID-19 data.
How data flows in the United States is complicated. The main problem facing our domestic public health infrastructure is that it's badly outdated.
When the pandemic started, in my state of North Carolina, they were still making reports about cases of COVID in the mail and through fax.
You have to think of the public health information infrastructure like a piece of glass that someone threw really hard at the ground and is shattered into 1,000 pieces. Because it's a federated system with the control sitting at the state level, information doesn't flow well. The CDC can ask for information, but there's no requirement. You can't pass a law that says the federal government has to receive these data from the states. And so what we have to understand is everyone was on their own throughout all of COVID. We were working in silos, and that's not a good way to fight a pandemic.
Many times, a data system in Chicago and maybe one in San Francisco and another in Houston, they will code all the data differently. One system may say male, female, MF. Another one may say 1-0 for male and female. Another one may have a totally different designation. And when you try to put that data together to create a national picture, if there isn't an agreement on how that data is recorded, there's no way to make sense out of that.
With more than 1,000 deaths reported yesterday, many states are struggling to contain COVID outbreaks. Former CDC head Dr. Tom Frieden says to do that, the country urgently needs much better collection of data.
It's not the state's fault. There isn't a national standard. And the two crucial things that we don't have access to are what is our personal risk of getting infected with COVID if we go out, and how well is our government and society doing in our community to reduce that risk. If we're flying blind and we don't know how badly we're doing, we're not going to improve it.
There's so much in our community that we just don't see. We need good data to make the right diagnoses and then come up with the right treatments. The promise of better information is what can unlock our health.
Disease doesn't exist until we name it. Disease can be all around us, but until we say it's a disease, it can exist without any concern. Who's dying and who's not dying, in some sense, determines whether or not the broader society, the professional community, recognizes it as a problem and recognizes it as a disease. It used to be that we took symptoms of illness, people vomiting and getting fevers, as the symbol of what a disease was. But today, we're beginning to realize that some diseases aren't what's called acute. They don't just occur a few hours or days after we got exposed to something, but they actually may occur sometimes years, decades after we've been exposed. They're non-communicable diseases.
Non-communicable diseases include things like heart disease, cancer, diabetes, and chronic lung disease. They cause 70% of global deaths, but they only receive 1.6% of global funding. Many people think non-communicable diseases are not preventable, but in fact, they are preventable causes of death.
In 1993, we wrote a paper on the actual causes of death and not what is the terminal event that's put on a death certificate. What really causes people to die? We went through the usual stroke and heart disease and cancer and so forth. We found three things were responsible for 40% of all deaths in this country. Tobacco was one of them, diet was a second, and alcohol was a third. But no one actually puts that on a death certificate.
Public health and data are actually synonymous. When you think about someone who's 16 years old, who picks up a cigarette, and trying to connect that cause to cancer when they're 60 becomes much more difficult unless we think about how we create a data system that can track that.
Tobacco use affects all those leading causes of death that we're concerned about. So we have an opportunity to affect a lot of serious chronic diseases when we do tobacco control.
People forget that you could smoke on an airplane. We've now changed societal views.
When I lived in New York, you had secondhand smoke, you had smoking in restaurants, and now it's not there. We changed the environment.
I don't think there's anything that any of us that have been elected to serve the people of New York will do in our entire lives that will have the kind of impact that this legislation will have.
Talk about tobacco. We really worked on policy and taxes. Those are the things that really get to change people's behavior. You have to make a very conscious choice to go out in the freezing cold and smoke that cigarette.
Life expectancy in New York City increased by 3 years during the Bloomberg administration.
So much of our ability to make a difference has depended upon identifying a problem and critically beginning to move to do something about it. Without action, public health data is sterile. That was the significance of the work of John Snow. Our public health history is really about identifying those pump handles and removing them.
We remember Jon Snow now because we like to have this nice story where our knowledge and our technology instantly kind of changes our behavior and puts us on this path of progress. But, that's just a pretty story we tell. When he died, he barely got a good obituary. He kind of became like persona non grata for insisting on his, marginal, weird idea. As a journalist and a writer, you're always interested in, well, how did the story begin? Cholera is caused by a bacteria, which normally lives in marine habitats. It lives in kind of tropical brackish waters. The birthplace of cholera as a pandemic came out of most likely the Bay of Bengal in the Sundarbans region. People didn't live in places like the Sundarbans for most of human history because these are places that are covered in marshes and mangroves. It's flooded tidally every day, so half the time there's no land there. Humans did not interact with cholera-rich water for most of human history. But then, over the course of the colonial period in South Asia, the British Raj decided to cut down the Sundarbans, cut down all these mangrove swamps, turn them into rice paddies. We can imagine that if you had a lot of farmers and fishermen living in this area with lots of cholera-rich water around, that bacteria from the water would have made its way into the human body. The first cholera pandemic began in 1817 in the area of the Sundarbans, and then moved with the bodies of traders and soldiers and travelers into parts of the old world, into Russia, and then over into Europe.
New means of transportation brought the world tight and close together, making it one tremendous and congested city.
And that was the beginning of the first cholera pandemics in the United States.
When the cholera hit New York, and it was much heavier and affected more people than we expected, we explained it in terms of newcomers, the Germans or a few Irish that were coming before the potato famine. And we began to see that the evidence of cholera was strongest among those communities because they're living in horrifying conditions. We ordered the population to go to church and pray on Sunday for God's redemption, but we didn't really do anything about it.
In the case of cholera, we understood that it was carried in the water years and years and years before we actually did the things that got rid of cholera. In New York City, it took decades. Private interests were much more powerful than public health actors and agencies. And commercial entities didn't want to close down the canals, didn't want to close down the Hudson River, didn't want to close down the ports in New York City around Manhattan because that was bad for business. They could see even at the time that cholera was clearly coming down those waterways and entering the city. And quarantining would have been a reasonable response to that at the time, given what they knew. But they didn't do it. Again and again, cholera entered New York City through the Erie Canal and the Hudson River, and the authorities in New York City didn't do anything about it at all. And eventually they stopped publishing any statistics about how much cholera was happening, to such an extent that a group of just private physicians got together to say, well, we see all these cholera patients. They're dying in our offices, in our hospitals. And they started publishing bulletins about what was happening.
Let's go to Abigail.
So in thinking about this data issue, I think it's a lot more complex than even what's being discussed right now. My organization put out a report titled Data Genocide that looked at both racial misclassification and also how states were not reporting race and ethnicity around COVID-19 case study data. We are effectively not including these populations that is directly contributing to the COVID infection rate.
Every single day, I'm fighting for the visibility of our people.
The erasure of Native people through data is what I consider a cultural genocide by the United States government, where they no longer have to fulfill treaty rights because we can't even prove we exist anymore.
As an urban Indian health program, as an Indian healthcare provider, we have a treaty right to quality healthcare. And yet the Indian Health Service has always been chronically underfunded, funded in between 30 to 40% of known need.
When you think about public funding, you fund what you know. And if there are no data, then there's no information. If there's no information, there's no problem. And if there's no problem, why would you fund it? So if we can't get the data we need to understand the challenges we have, we'll never be able to muster the political will to actually confront those issues.
We decided that we were going to do a report card of every state in the nation on how well they were doing in reporting race and ethnicity of American Indians and Alaska Natives. This was the closest number we could get for the number of Native people, and we recognize that this is an undercount. The state of Washington received a C, and that's because it was doing good in 2 areas. It got an A+, and then 100%, and then it was absolutely failing in the other 2 areas.
I think we have to be honest that data systems, if they do not utilize an equity lens, then they miss out on so many people. That's a problem. And I tell you that from a Asian American standpoint. I mean, if you think about Asian Americans, we come from so many countries across the globe. And yet when you say the word Asian American, it's almost as if it's a one category. But I will tell you, the health needs of South Asians, very different than the health needs of Southeast Asians, but we aggregate and we clump and we put people in categories and buckets, and then we turn around and say, well, there's not a problem in your community. Shame on us. Of course there's a problem in the community. It's because we have aggregated you, so we have masked your inequity.
I did hear from Washington State within 2 days of publishing this report, and they want to work with us, and we're beginning to start meetings with them so that they can begin to report race and ethnicity better.
Decision-making, it can only be done robustly if you have robust data systems that are strong, they're sustainable, they're strategic, and ultimately that they work for all of us. We have to do better by our people.
Sometimes they describe epidemiology as individual stories with the tears washed away. People want to know what the data is, but what moves them to change things in our society is what has happened to them or their neighbors or their children.
I just can't ever accept body bags for our people. I needed to be able to reclaim this body bag into something that was of joy, of healing, of strength, and resiliency. Each of the ribbons represent prayer. Here on the sleeves, I had started to work, and I got a text from a friend of mine to tell me that a mentor and a dear friend had passed on from COVID-19. He wasn't old enough to be lost this soon. And so I picked up the dress and I decided to incorporate the toe tags. And on here, you'll see that there's jagged stitching. It represents the marks that you would see on a body from an autopsy. This is something I say to myself all of the time. I'm a tangible manifestation of my ancestors' resiliency. All of the statistics that we've seen around COVID-19, around other health disparities, lose the people and lose the story. Every data point is a mother, is a father, is a son, is a grandparent. And this dress represents to me data. Data is an indigenous value. It's not just a statistic. It is a traditional way of us using information to improve the health and well-being of our people.
Most of our data modernization can be done through installation of computers and software and really the modern tools that we use in our everyday lives that haven't made it to most state and local health departments. There is a $1 billion program called the Data Modernization Initiative that is upgrading our nation's public health data infrastructure and really trying to bring it into the modern era.
There have been some very promising developments that enables data to flow from electronic health records into public health systems seamlessly in an automated way. We have the capacity, if we're willing to invest the resources, to automate as much as possible so that our frontline epidemiologists can get information that's up to the minute.
I think about how we get the weather forecast on our phones every day and how we use it to make decisions without even really thinking about it. The National Weather Service is a many decades old institution that has evolved over time. And it has evolved with investments in data, in people, in analytics, in scientific infrastructure. And I think someday we might get to the place where we do something similar with infectious disease forecasting. I can imagine a world where I decide whether or not to grab a mask before I commute on the metro, or whether that birthday party actually needs to be outside and not inside because there is a virus circulating in our communities. And I think we really are at the place of creating this infrastructure.
I think the promise of data in terms of healthcare and in terms of pandemic control is a real one. If I'm willing to share my location, the list of the people that I've interacted with from my cell phone that pings with someone else's cell phone, maybe we can actually stop a pandemic in its tracks.
The speed with which we're sharing information is beginning to approach the speed with which the pathogens move.
We now have the capabilities through cloud computing and artificial intelligence to really apply these new sciences to public health.
The anticipatory modeling of future outbreaks requires tracking people that are flying around the world, that are going into assisted living facilities, into and out of hospitals, daycare facilities, so that you can potentially understand where that disease might be going next. That idea of turning the world into data in the name of these efforts to prevent outbreaks, to a lot of people, it seems like we're losing our privacy.
When we talk about data, people often think of it as almost dehumanizing. People need to know that we get concerned and worried about these numbers because they are real people.
It dates back to the bills of mortality. When you die of leprosy and they put you on the bill of mortality as one of the 7 people who died of leprosy that week, you have become a number. In your dying moments, you are recorded and registered and distributed as a data point to be analyzed by the authorities. In a sense, it was a kind of Faustian bargain that we made that, you know, we will surrender this data about our health so that we can live longer lives. We doubled overall human life expectancy in part because of the data that we collected and the patterns we were able to see in that data.
A public health data system that is built upon privacy and security is absolutely essential. First of all, to be successful in identifying and stopping disease outbreaks, but even as important, to maintain the public's trust.
Corporations have much more data about us than the state, especially in the United States today. People are much more willing to give up that information to the Amazons or Googles of the world. And it's information they would never dream about giving to Donald Trump or to Joe Biden. These corporations don't necessarily have public health in their interest.
We need to restore the idea that the central authority responsible for protecting people's health is government.
Over the past 24 hours, more than 3,000 deaths from the virus have been reported across the country. That is larger than the death toll on 9/11.
Governor Jay Inslee's office has confirmed the governor will be holding an 11 o'clock news conference tomorrow to outline a new set of restrictions.
Inslee has overstretched his authority.
We cannot allow one virus to destroy this Constitution.
There is a natural tendency, I think, to be suspicious of power or authority, especially if it's talking about something that's invisible, like viruses. But there is also enormous consequence for resisting public health authorities.
It became clear well into the COVID pandemic that one of the main factors affecting deaths and other outcomes was the level of trust between the people and its government and between people and each other.
We do really well with passive public health. We do really well when there's a policy that's passed that you don't have to actually do anything to participate in the safety that you get. But to ask you to wear a mask, that's a more active version of public health. And that's where we're finding the greatest resistance.
A lot of people don't want to wear masks. There are a lot of people think the masks are not good.
Many politicians have told us for the last several years that your health is in your hands, and that things like masks or indeed vaccines were about lowering your individual risk, when in fact we needed to ask, what is my contribution to everyone else's risk?
This dichotomization of us and them actually completely hampers our ability to be safe. The real threat is the pathogen and the way we respond to the pathogen.
Everything we're seeing through the COVID pandemic is just symptomatic of a broader disease of mistrust and a distrust of government. It's the same disease that led to the January 6 riots.
Just as Trump supporters breached the nation's capital today, a local group of protesters surrounded the governor's mansion in Olympia.
Certain people feel like public health or the well-being of others or even our responsibility to not spread a contagion was not the number one thing to be concerned about.
You do not get to keep your authority when you take our rights.
I revile these acts of sedition and intimidation that we've seen in our nation today. But those acts of intimidation will not succeed in any way, shape, or form. We will continue the work we're doing to protect the health of Washingtonians.
You could smell smallpox before you enter the room. The pus ends up giving a stench of decaying flesh.
The eradication of smallpox was one of the seminal achievements of the last century.
I see vaccines as the very foundation of public health.
A vaccine is just a product, and it is useless without vaccination, which requires social trust.
Smallpox disappeared so fast because they trusted us.
The amount of vaccination we're doing is not enough to bend the curve.
I was sharing with the church, when the vaccine come out, I won't take it. The trust level is broken.
From the beating heart of global finance, economics, and politics, and wherever newsmakers are moving markets, Bloomberg brings you conversations that allow for deep discussions and important insights. What do you think the future is for inflation? Is this a new normal? Are markets too optimistic? How do you worry about the things that are outside your control? How does the current fighting completely stop? I'm Francine Lacroix, and this is The Pulse, every weekday only on Bloomberg. Asia is a continent of contrast. The region is a nexus of rich cultural traditions and a vibrant hub of trailblazing innovation and modernity. How will it push the limits of technology even further?
Going to space should become as easy as, taking a flight.
If NASA is designing a lander, their approach is they're designing a Formula One car. So we take, say, a Jeep approach.
Min-Seok, give us a sense of how you translate Korean architecture for the rest of the world.
We call this madang. In general terms, it's where we can be ourselves, where we belong.
There is an old saying in Korea that says, "Call me blue, hwai 불치." It means simple but not humble. So it has a tremendous impact on Korean architecture.
People tend to think the robot AI taking the job from them. We want to use the robot as a basic asset, meaning people have an income through the robot.
From space tech in India to robotics in Japan, Asia is driving the future, reshaping industries, societies, and the way we live. Join me as I take you through the bold innovations. Discover Asia's next-gen technologies on Momentum.
It's the world's second largest economy with a growing influence in global affairs. But geopolitical uncertainties, deflationary pressures, and questions about foreign investment linger. Bloomberg, the China Show, brings you the unmatched expertise you need to keep track of breaking news, in-depth market analysis, and the most influential newsmakers in and around China. Bloomberg, the China Show, weeknights at 8 p.m. Eastern Time, right here on Bloomberg. Context changes everything. Season is here.
I know it's like your Super Bowl, right?
I can't wait. It's like opening presents in the morning.
All right, it will be exciting.
Nobody covers earnings like Bloomberg.
If you look at private equity just as one piece of the institutional equity market, there are 3 times as many dollars invested than uninvested, right? So you have about $3.5 trillion in the ground that needs to get resolved versus about $1.5 trillion that's wanting to be invested. So if you're a private equity manager, you're trying to decide, do I take my capital and put it into my existing portfolio to either defend what I own or to try to grow it and create more value? Or do I use some, to your point, some creative financing to extend the duration or the runway of what I own and then try to put the capital into the new market environment? And everyone's taking a different approach. It's a function of where you are in your life cycle. Everyone is dealing with that. Even the highest performing PE firms, you're seeing slower fundraising. And in this deal environment, you have to start thinking creatively about how to get liquidity back to your investors.
The Middle East and Africa regions are home to some of the biggest deals and fastest growth in the world. Vibrant resources and high-yield investment opportunities abound. I'm Jumana Versace. Join me on Bloomberg Horizon's Middle East and Africa for the stories, newsmakers, and insights shaping the decisions of traders across this exciting region.
We're scaling up at incredible pace.
This region is growing so rapidly.
The opportunity is really huge.
Only on Bloomberg. Context changes everything.
As we spend some time here on the broader presidential race,
let's focus in on European politics.
Makes you wonder how politics might play out.
Get your fixed income fix. Watch Bloomberg Real Yield every Friday at 12 p.m. Eastern, right here on Bloomberg. Context changes everything. Welcome to the world of decentralized finance.
Massive outperformance from Bitcoin.
Bloomberg's covering all things crypto, the people.
The tectonic shift emanating from Washington.
All we're looking for is clear rules and an ability to build in the United States.
Crypto shouldn't be partisan.
The transactions.
Really a record-breaking moment. Crypto VC is back.
And the technology.
It's really the beginning of a global on-chain economy.
And if America doesn't embrace it, we're going to be left behind.
Bloomberg Crypto, Tuesdays, only on Bloomberg.
As a result of the crumbling infrastructure of public health surveillance systems, we currently do not have the ability for both the states and the CDC to properly report COVID-19 data.
We now have seen real time what happens when you ignore public health. A lot of people are going to die.
in February of 2020. We started hearing from local jurisdictions of excess mortality among African Americans. These were not small gaps. These were big ones. And it turned out that that excess wouldn't be limited only to African Americans. We've seen it among Latinos, American Indian, Alaska Natives, Native Hawaiian, Pacific Islanders. They've paid a high price.
Having vaccines for COVID-19, I think that's a game changer.
The first vaccine for coronavirus here in the U.S. has just been approved by an FDA advisory panel.
People have been toying with this idea of developing mRNA vaccines for a number of years, but it was unproven. The sheer intensity of the crisis, the ever-increasing terrifying body count of those early days forced us to accelerate the development of a potential solution because we didn't have a lot of other options. It led to an unprecedented breakthrough.
Thousands of doses will be given to frontline workers as early as Monday.
We're just about to watch the first nurse at UW Medicine receive the first COVID-19 vaccine in our state.
I'm really excited to do whatever I can to show our people that we believe in the science that is currently out there.
Is it emotional a little bit?
I feel like I'm so overwhelmed by everything we have to do. Everything is a big, huge emotion. We'll do whatever it takes to ensure that our people are not disproportionately impacted by COVID-19.
Developing a vaccine is the first challenge. Getting people to accept the vaccine can be even more challenging. We've really seen an erosion in trust towards the healthcare system. That includes public health recommendations. It's in the middle of a pandemic where I think the messaging has been very muddled with regards to what we're asking people to do. Masking, social distancing, etc. And then you have the new vaccine.
I think we're just never going to get fully around some pockets of resistance because vaccines are an intervention that is given to people who are not yet sick.
There's a multitude of reasons why people don't want to get the vaccine. And a lot of it has to do with things that are not related to health at all.
Many people are afraid. We can't say enough about how unmoored and untethered all of us are.
We've become much more polarized.
A local group of protesters surrounded the governor's mansion in Olympia.
You do not get to keep your authority when you take our right.
There's been a rise in this anti-science denialism movement. That is something that we will be grappling with for years and decades to come.
I revile these acts of sedition and intimidation. We will continue the work we're doing to protect the health of Washingtonians.
There are social and economic issues. There are individuals still dealing with historical trauma. We need to look at these different social factors. Health is not just a biological construct.
Peaceful, everything peaceful?
Yes, sir.
Good. All right, good afternoon. Happy Martin Luther King Jr. Day. We have some really exciting news about multiple fronts on our efforts to bring vaccinations to everyone in the state of Washington. Today, we are announcing the start of what we think of as the second stage of our vaccination initiative. We are now moving from a limited number of Washingtonians to a rather broad scale where max vaccinations are now possible, called for, and are going to be implemented. Effective immediately, all Washingtonians who are 65 and older will be eligible to receive vaccines
This means thousands of more Washingtonians can and will be protected. With that, some comments by Dr. Shad.
Thank you, Governor. Today is a really important day for the people of Washington. The announcements we just heard represent the forward progress that we all are looking for. As of January 16th, we've given almost 295,000 doses of vaccine. That's the good news, but we need to do more. Our goal is to vaccinate 45,000 people a day.
With something like vaccines, in many ways, the distribution part of the equation is just as important as the invention of the vaccine itself. We had the smallpox vaccine for 160 years before we even started thinking about the capabilities to actually eradicate smallpox on a global scale.
In the 1960s, more than 2 million people died from smallpox every year. Just over a decade later, that number was 0, thanks in part to Dr. Bill Foege. In one remote Nigerian village, after vaccinating 2,000 people in a single day, Bill asked the local chief how he had gotten so many people to show up, and the chief explained that he had told everyone to come to the village and see the tallest man in the world. He was pretty tall.
I was looking for a mentor in global health and could not find people that had any interest in it. And I realized anyone interested in global health has to make their own way. And so in 1962, I entered the Epidemic Intelligence Service, and they announced the Peace Corps physician in India was sick, and they were looking for a 3-month replacement while they recruited. And so, by chance, I went to India, and that's when I saw smallpox for the first time. It's so much worse than you can imagine. It hurts to move. And if you move, you break these pustules, and the pus ends up giving a stench of decaying flesh. You can smell smallpox before you enter the room. And on 2 occasions, I think I was able to diagnose smallpox on the basis of smell. One time, it was fairly easy as I walked down the corridor of a hospital and suddenly felt that smell. The other time was in a slum in Karachi, Pakistan. And so the smell is competing with other smells, and I still was able to detect it. And we found the house, and we found the smallpox cases. We don't know when and how it started, but it can be traced back at least 3,000 years to Ramses V, who appears to have died of smallpox. In Europe, it was much more common as a childhood disease. 60% of all children would have smallpox. Voltaire had smallpox. Mozart had smallpox. His sister had smallpox. I mean, it's just incredible how many people had smallpox. In the United States, however, it would come and go, and people would go 20 years in a village, never see smallpox, and so they'd forget about it. It wasn't until 1721 when an outbreak in Boston caused a man by the name of Cotton Mather to try to figure out why is it that the slaves are not getting smallpox at the same rate as the whites. And so he asked his slave, who described variolation, where in Africa, India, and China, people discovered if you transmit smallpox through the skin, it had a far lower mortality rate than if you got it naturally by breathing it. But it wasn't until 1796 when Edward Jenner, a practitioner in England, became interested in smallpox because a milkmaid supposedly said to him, "Oh, I'll never get smallpox because I've had cowpox." Edward Jenner had no idea of the germ theory, no idea of vaccinology, anything, but he was trying to imitate nature. So he took material from the hand of Sarah Nelms, a milkmaid, and and he inoculated it into the arm of a small boy. And then, weeks later, he tried to give the boy smallpox, and it did not succeed. And this was the first vaccination. As soon as Jenner came out with cowpox vaccine, the first anti-vax group developed, you saw cartoons of people having cow heads growing out of their arm and that sort of thing. So the anti-vax movement is very old.
A new poll shows support for vaccinations has dropped 10% in the U.S. over the past 2 decades.
The World Health Organization called skepticism about vaccines one of the top 10 global health threats in 2019.
It's become worse in recent years because when the diseases disappear, people forget what the risk was of the disease, and all they see is the risk of the vaccine.
My beautiful nephew, who started having febrile seizures after his MMR.
Does the recent outbreak concern you at all, given your children aren't vaccinated?
No, it doesn't concern me one bit. I believe we have these illnesses and these sicknesses for a reason. Our bodies need to be immune to them.
When I meet with anti-vax parents, and I used to do that, I never blamed them. They were not trying to hurt their children. They actually believed they were doing the right thing.
We're sick and tired of being abused. We're sick and tired of living in fear.
This is a fascist overreach of the government.
But I have seen anti-vax efforts change from individuals who are really concerned about their own children to people taking this on as a philosophical or political resistance. It's disturbing that there is so much pushback because I see vaccines as the very foundation of public health.
The latest tally of vaccinations is 3 million doses administered. That's nowhere near the 20 million vaccinations goal set by Operation Warp Speed for the end of 2020. And U.S. infections have soared past a new milestone, now topping 20 million.
Within about a week, a combination of the Washington National Guard, Safeway, the Department of Health, the people who run the fairgrounds have put together an operation that's done over 700 vaccinations just each day in the last couple of days. There are 3 other sites that we've also stood up, Tri-Cities, Wenatchee, and Spokane. We want to get everybody who wants a vaccination vaccinated. We just could not be more delighted about how functional this operation has been so quickly to bring so many vaccinations at such a critical period of time.
America tends to go for technological solutions to big problems. So in the case of diseases, we try and go for vaccines and drugs rather than social fixes. The problem is that epidemics and biomedical solutions flow in opposite directions. Epidemics seep downward into society's cracks, taking out the most marginalized and most vulnerable people first, whereas biomedical solutions rise upwards into its penthouses. People with privilege and power and money and connections get earliest and easiest access to things like vaccines, and then being safe, they move on. And they decide for everyone else that the problem is over, when it in fact is not.
This is just one location for, basically the greater Southwest region of Washington. And also in terms of access and equity, this is a drive-through site, which we are working right now with local transit to figure out how we can accommodate folks who might not have a car, but a community center, which folks are already used to going to, or partnering with other community partners, might be a better modality.
One of the purposes of the book of Revelation is to divulge God's own purpose. God's purpose is to lead people to repentance and salvation, to lead them to the glorious inheritance of the great redemption that is to be given to all true followers of the Lord Jesus Christ. Look at here. God is not a mean God sitting up high just waiting on us to mess up. That's why He gave us Christ. Look, God don't want us to fail. God wants us to make it. Not only does God want us to make it, but God wants us to make it with joy.
Church to the black community is crucial. Dr. Brazil was a firm believer that the Bible should stay up here until it's getting ready to use it. And that's Dr. Brazil. The late Dr. E.S. Brazil, he kind of set the Shiloh Church up to be a church in the community. He, you know, if someone needed his service and if he could help them, he would. When he passed, I kind of, you know, just inherited the church. By the grace of God, I knew I was walking into that type of ministry, that whoever's going to pastor Shiloh just can't be the pastor of Shiloh. The pastor has to be able to be connected to the community. Our members and people in the community don't trust Walgreens, don't trust Safeway, you know, but they still trust the church. COVID-19 is a test, you know, and how God is calling us to be faithful even in this pandemic. I have a responsibility to be as candid with the people as possible. I was sharing with the church, you know, well, when the vaccine come out, I won't take it.
The stats are staggering. Nearly 1/3 of Black Americans remain hesitant to get the vaccine.
The amount of vaccination we're doing is not enough to bend the curve. We need to get up to, 70, 80, 90% of people vaccinated. There are issues around access that we know about. And then you layer on top of that, the historical injustices and suspicion of government and suspicion of healthcare. So there are people who really need the vaccine, but they're afraid to get it.
Government has never been friendly to African Americans. The trust level is broken.
In 1932, Black men who had syphilis were recruited into a government study and told they would be treated for their syphilis. Unfortunately, there was never an intent to treat these men. It was intended to follow them. But what's really horrific is that 15 years into that study, they actually came up with a treatment for syphilis, an effective treatment, and it was not given to these men. And this study went on for 40 years, and what people don't know is the Office of the Surgeon General actually oversaw that study, the United States Public Health Service. So every day I walk into my office, I walk past a wall of men who actually did this to people like me. And I'm sorry it makes me a little bit emotional when I talk about this, but this is something that we have to acknowledge.
I'm saddened today to think of those who did not survive and whose families will forever live with the knowledge that their death and suffering was preventable.
A lot of folk want to point to the Tuskegee syphilis experiment as a source of the mistrust of science and the medical establishment. But added to that are a variety of other things having a great deal to do with the experience that many people of color have in a doctor's office.
We have plenty of evidence to show us that there is differential treatment between Black patients and white patients, that physicians often underprescribe medication for Black patients and falsely think that we have thicker skin than white patients and therefore can tolerate more pain, which is directly connected to slavery.
Many folk who study the history of slavery will tell you doctors often did all sorts of experiments on African American slaves. So the idea that there is a long, deep history passed down from one generation to another, that combined with their own experience of problems with a medical provider, indifference on the part of a medical provider when you're trying to describe a problem, means that at a moment when we need people to believe us, when they need to trust the word of a researcher, when they need to trust the word of science, you are still going to see this legacy that's going to block our ability to make those communications have an impact.
My fears center around people losing trust in public health. And that's what has to happen, is that we get the trust back of the public and that we deserve the trust. The talk about eradicating smallpox had gone on for some years, but it was always at the periphery. The first time this was proposed, only 3 countries voted for it at the World Health Organization. It wasn't until a scientist from the Soviet Union, Professor Stonov, got American scientists involved in this, and when both countries presented it, this time it passed. The first part of the program was to eliminate smallpox from 20 countries of West and Central Africa. I was already in Nigeria working for a church group when CDC asked if I would be a consultant to the program. At that time, so many hospital beds in Africa were actually supported by church groups. But they weren't doing community health work. They weren't doing public health work because they were using health as a way of proselytizing. I was trying to introduce a public health approach to church groups. They needed to work with government. They could no longer be working on their own. The colonial period was over. Going into another culture, one can actually appear to be obnoxious, that you're coming to tell people what to do. And one of the things I learned is when you tangle with culture, culture always wins. And so you have to go in and find out what is it the people want, and then see if you can provide that, rather than tell them what they should want. In eastern Nigeria in 1965, there was an anthropologist who described smallpox as being like water, that it permeated everything in the culture, and that people were afraid to talk about it, and they were afraid to talk to each other, and how it disrupted life. And so they lined up for vaccinations. In December of 1966, I had a radio call from a missionary saying, I think we have smallpox in Agoja province. That was the first case I had seen in Africa. We were trying to figure out what to do because we didn't have our supplies yet. We had a small amount of vaccine, but not enough to do a job like this. So we got on the radio that night with maps in front of us and divided up the area with the missionaries, asking if they would send runners to every village in the area assigned to them. And the next night, 24 hours later, we could tell exactly where smallpox was. But you don't want to waste the vaccine when you don't have enough on people who will not be exposed this week or this month or this year or ever. So we decided to use the vaccine only in those villages with smallpox. And we used the remainder of the vaccine where we thought it might spread. The strategy at that time from WHO was mass vaccination followed by going after outbreaks. All we did was eliminate that first strategy and went directly to the second strategy. When I was a forest firefighter, we were drilled over and over. You can't have a fire without fuel, and therefore your job is to remove the fuel, and that's why you dig a fire line around a fire so that it can't jump over. The same thing happens with smallpox. By and large, that virus cannot go very far. And so if you have a fire line 6 feet out from a person with smallpox, you're going to stop almost all spread. This had worked so well in eastern Nigeria, then we tried it in other countries in Africa. Some places were very creative. In Togo, they actually trained 12 people on motorcycles who would be the smallpox group, and they would go out to smallpox outbreaks. By early July 1967, we had only one outbreak left in eastern Nigeria. This was a program that was supposed to take 5 years, and in 6 months, we were down to the last outbreak. And pretty soon it worked in all of West Africa, where country by country, the same procedure was followed. Smallpox disappeared so fast because they trusted us. And it was enough to convince us it was possible to try this in India. We went to India in October of 1973. After 6 days of searching in Uttar Pradesh and Bihar, the searchers found 10,000 new cases of smallpox that no one knew existed. We were overwhelmed, and some people said, this is just making us look foolish, but we said, no, we have to do it. We have to keep doing it. The Coalition for Smallpox Eradication in India was unbelievable. When you think of smallpox eradication, you're really talking about hundreds of thousands of people that were involved in this. And for each one, it was a contribution that you can't put a price on. It took us about 3 months to perfect the surveillance system. We found we needed to be much more specific. So we tried a house-by-house search. We had people putting marks on the door to show they'd been there. Then we found we needed secondary surveillance. And so we set up surveillance systems in marketplaces, going around with a smallpox picture. Have you seen a person like this? And that would help us to find villages that had not been reported. Then we needed tertiary systems. That is, go to places where we were finding the smallpox, but it was difficult. This would include beggar communities, where people didn't often go. It would include the people who were making bricks for roads and so forth, because they were always moving. And we got to a point where surveillance was so good that after 3 or 4 months, I said to myself, you know, it can't get better than this. Containment was much more difficult. With 10,000 cases, what do you do? And so we asked people, just go to that village, vaccinate the people in the house and the houses around that house, and then move on to the next village. Soon we realized we had to put watch guards at the house, not to keep people from escaping, but to keep people from going in to visit the sick people and then coming out with smallpox. And because you can give a vaccination on the day of exposure and prevent the disease, all we did was vaccinate those people, but we didn't interfere with the culture. Those people could still visit a person with smallpox. It required hiring more and more people. I mean, it was really an army of people. Doing this without smartphones, no computers in the field. I was so comfortable at this point, I could almost see the end of the program. In my mind, there was no way of failure. There is a feeling in global health circles that people parachute in to do something, and oftentimes they talk local people into doing what they don't want to do because there's money involved. And that is a feeling that I don't like to be part of.
We don't believe in any kind of discriminatory treatment.
With everything India had gone through with smallpox and all the criticism that they'd received along the way of how can you be a modern nation and continue to have smallpox, that I thought it was important for India to get the credit. They're the ones that put in 99+% of the people, the resources. We were a fringe on the edge of that. They deserve the credit.
The eradication of smallpox was finally completed in the mid-70s. When you look at that story, it really leaves me with this feeling that we just have the wrong set of heroes in society. You think about two events that happened more or less in the same time. One is the Apollo program, sending man to the moon for the first time. And the second is the eradication of smallpox. Ask your average, 10-year-old, do they know anything about the lunar missions? Of course they do.
Tranquility Base here. The Eagle has landed.
That stuff is seared into our collective memory.
That's one small step for man.
But how many of us are familiar with the smallpox eradicators? They took this virus that was probably the single most deadly killer in human history, and they eliminated it from the face of the earth. And yet, think of all the movies that have been made about astronauts. What mattered more? We would have a lot less vaccine hesitancy in the world if we taught smallpox eradication as one of the seminal achievements of the last century.
I've probably spoken to about 2,000 to 3,000 vaccine hesitant people during this pandemic alone. I think the most basic takeaway that I've learned from this is and it sounds very simple, but it's really to have empathy, that individuals that do have concerns about vaccines, that is a real concern for them. And I think the reason why they do have those concerns is because they haven't been able to speak to someone that has been empathetic and compassionate towards that concern. The larger structural issue that we're facing is really the distrust in government. People see the vaccines as a product of that government that they distrust. And there have been a number of studies that have looked at the correlation between trust in government and vaccine acceptance, and it does correlate. But I think the onus is upon us to understand why that might lead to individuals saying, you know what, I don't want anything that the government is providing to me.
COVID arrived in the U.S. sort of as a spark on dry grass. Anti-science, anti-truth, too much income inequality, too much disadvantage that's enshrined by structural racism, too few people with confident access to health care. All of these things were what drove a real prairie fire of COVID-19. And it was predictable. It was predictable. A standard feature of U.S. medical education is that teaching hospitals are located in poor neighborhoods. When it came time for me to pick a residency program, I decided to train at Harlem Hospital. The sickest patients I ever had were the patients on the ward there. Just everything about their lives had broken them down. And I'm not just talking about drug use, which is what people often think. I'm talking about everything that left people with heart disease, cancer, the common killers. None of this is in our genes. All of this is related to what it means to be classified as a person of color.
At the beginning of the 1900s, W.E.B. Du Bois said, do not locate the problems of health in the bodies of black people. Understand the social context in which they live. In the city of New York, your life expectancy fundamentally depends on where you live. The life expectancy of the richest neighborhoods in New York can be as much as 11 years greater than the life expectancy of those who are in the poorest neighborhoods of New York. We live in a society that is highly segregated, and as a result, the notion that where you live has a great deal to do with the quality of your health, up to and including how long you will live. If there's a better expression of structural inequality, I have to admit, I don't know what it might be.
So often when we talk about inequities or we talk about disease outcomes, we talk about it through a lens of race. But it's important to be clear that it is racism that is the issue here and not race.
It was in 2019 that we marked 400 years since the first person was brought against their will from Africa to the North American colony of Jamestown. And the fact that enslaved labor was what catapulted the U.S. into the ranks of wealthy nations is not one that people are taught or even want to think about. I think a lot of our understanding of public health benefits from an understanding of history. And so does our understanding of what we are now calling structural racism.
Starting with 1641, Massachusetts became the first colony to legalize slavery. The politicians worked with the business interests to develop, implement, and enforce these laws. Connecticut, New York, and other colonies then followed suit. And as if that were not enough, these policymakers worked on developing policies that explicitly prohibited Black and Indigenous groups from raising their own food, from earning their own money, from learning to read and write. They were prohibited by law from going within a certain radius off the plantation. They limited their movements. You can see the effects of these policies on health, even today. There's this notion that, well, you know, why aren't you exercising personal responsibility? You should be eating correctly, you need to exercise. But we know that those behavioral health determinants play a small role in our overall health. You know, the overarching determinant are these social determinants of health.
Choices people make are determined by the choices that they have. If you live in a community where there isn't a grocery store anywhere near, but there are fast food restaurants, trying to make the healthy choice is a difficult choice.
When we talk about the social determinants of health, we're talking about everything outside of the 15 to 20 minutes you may spend with a healthcare provider on occasion. That's everything from education to transportation to your access to food, to housing, to your employment status. These systems allow for inequities to not only begin to fester, but they perpetuate them.
Black infants are highly vulnerable in their first year of life. We know infant mortality rates are 2 times higher among Black infants than they are among white infants. This is not something that occurs only among poor women. We see the racial disparities in infant mortality even among Black women who have high levels of education and income. So this suggests that it's about more than access to care, and that it's really more about things that we have a hard time measuring, which might be the exposure to discrimination and racism in the society. An African American child is more likely to develop obesity by the time they're 2 years old. So that tells you that there's something going on very early in life or in the intrauterine environment that causes that. We know that there are biological changes within a woman's body whereby if she's experiencing stress, it can be transmitted to that infant. And so it's not surprising, as devastating as it is, that infants of color die at higher rates than white infants in this country.
For every social determinant was a preceding law, policy, regulation, executive order, ordinance, you name it, that created the structural conditions that these folks find themselves in, and that play a disproportionate impact or role in their lives. In the early 1900s, the Homeowners Loan Corporation Act was developed by Congress, signed into law by President Franklin D. Roosevelt. That law authorized property appraisers in over 200 cities in America to go out into the neighborhoods of these cities and to grade them from a scale of A, B, C, or D and align them with a color code. The A communities were aligned with the green color. These were your affluent white communities. The D communities were your quote-unquote hazardous communities, and these were your primarily or predominantly African-American communities. And this is where we get redlining from. It determined where to give VA loans and FHA home mortgage loans. And in so doing, they essentially starved these Black and brown communities of the resources that they need to survive and thrive. You might have noticed a major highway cutting right through these communities. Or you may have seen a railroad track splitting the neighborhood in half. Major parking lots, right? Factories, toxic waste sites, right there abutting these communities. And so we have been able to understand why there are higher rates of asthma in these Black and brown communities. We've been able to tie it to the smog coming from these highways. They cut these communities and split them in half. We can see the impact that those policies from 400, 300, 200, 150, 10 years ago, and all the way up until today are having on our health and well-being.
Many of the problems we had with COVID-19 weren't just a function of the virus itself. It was the conditions that the virus was able to exploit. Hypertension, diabetes, cardiovascular disease, certain forms of cancer. But COVID-19 was something that could even hit the most powerful members of human society. The Prime Minister of England, the President of the United States gets infected with this virus. If you thought about it carefully, the best way to make sure that folk in rich communities were protected from the ravages of this virus would be to make sure that their neighbors in poor communities of color didn't have conditions that created the risk that they themselves would face.
The pandemic has just highlighted so many inequities that underscored what we all always knew. Yet the work, in many ways, has derailed.
All the work we've done for the whole time I've been here, active living, healthy eating, chronic disease prevention, that all got sidelined. I was like, no, we need to bring it back. This is why you need public health. It became very clear to me. I mean, literally, because of the pandemic, I wasn't riding the bus to work anymore. I was riding my bike more, and I was riding down the east side, go to my produce store, and I get south of city limits. All of a sudden, the housing quality goes down. And it clicked. It's like, oh, no wonder, right? Who lives on the east side? Mm-hmm. You've got Black communities, you've got Pacific Islander communities, you've got Latino communities, you've got, Eastern European communities.
Yeah.
COVID basically was it was pulling the scab off. These are the same communities with high rates of chronic disease. Right now, just as the rest of the country, the areas with the highest case rates are the areas that have the lowest vaccination rates, where people are refusing to get vaccinated or sitting on the fence and not getting vaccinated, right? So we've got to work with them. We cannot ignore them because it'll affect the health of everyone else.
Well, that's true, because you cannot end a global pandemic until you address the pandemic globally. And that applies not just to the rest of the world, it also applies right here in the state of Washington. We're all at risk at some point if any one of us, any one part of our communities, wherever those communities are not protected.
The idea that we're in this together is still a lesson that I think people have a hard time learning. If it is clear that this virus thrives, changes, and evolves in places where there is a reservoir of infection that has not been treated, where there haven't been enough vaccinations, that means that many parts of the world will continue to be a source that will create variants of the virus that we will struggle almost forever to try and confront. The fate of my community may be very closely tied to the fate and health of your community.
My interest in health, I think, started from childhood in the early 1970s. Strolling in the streets of Asmara, Eritrea, which was part of Ethiopia at that time. I saw posters about smallpox eradication. That's when I was introduced to World Health Organization. Global public health actually cannot exist without local public health. We're intertwined. The world is smaller. The world is more globalized. Viruses can move faster. The threats are common. Anything that happens in the poor countries can reach the rich countries within no time. So we need to help each other. It's a shared problem, then we need to have shared response. If we believe that we are one humanity. It's important to remember that eradicating smallpox led us to stop routine smallpox vaccination in this country. It's always been a surprise to me that a virus with no brain, no central nervous system, can somehow outsmart us. And yet that's what happens all the time. But evolution is slow for the virus, even with the coronavirus. It takes weeks or months to come up with a new variant. We've got to constantly improve our tactics so that we could stay ahead of it.
Hey, Pastor Christopher.
Dr. Chin.
Good to see you.
There's no doubt in my mind that the majority of Shiloh is not going to be some of the first to take that COVID vaccine.
I remember one of the things you said to me was that you personally had some concerns.
I did.
Right, because there was a lot of distrust. There are a lot of things that public health cares about that people don't realize we care about.
Right.
Well, you know this, right? It's like someone's health isn't just their medical health. It's their, whether they got a home, whether they got a job, their mental health and all that. So
people want to know that others know what's really going on, and they're not afraid to say it. But I never thought of having that conversation with the Pierce County Health Department.
This pandemic has led to a lot of uncertainty. I think for many, the vaccine represents more uncertainty.
The vaccine is the mark of the beast. They figured out.
During times of uncertainty, people are more likely to listen to and believe conspiracy theories. The number one concern individuals had with regards to why they did not want to get the vaccine that I've spoken to, and these were particularly individuals of color, is because they were convinced that there was a microchip in the vaccine. When they brought that concern to their doctors dismissed them. I think that's the exact wrong thing to do. How do we improve this communication so people don't feel as though they're being dismissed or they're being ridiculed? I spend time explaining how the vaccine was developed, how scientists are community members just like you and me, and how the data that came out with regards to safety and efficacy was really looked at by individuals that care about the health of our communities.
this comes up again when you talk about vaccines and do people trust the government administration behind the vaccine. I would never distribute a vaccine that didn't work and that wasn't safe.
The community that I travel in, you know, always had great respect for you.
So, you know, I think that this, you know, really have appreciated the opportunity to work with you.
Same here, Dr. Chin, same here.
From the sound of my voice right now, Lord, just continue to bless those that's on their way right now, Lord.
Churches are extremely good at supporting the members in their congregation. We're just giving them the messages to deliver, the medical content to deliver, and they ran with it.
Amen. We do want to continue to ask everyone to please continue to wear your mask. If you are infected with COVID-19, it can do more damage to you than you believe that it can do to you. And so we just want to encourage all of us to get vaccinated. They're still saying that African Americans are falling behind in getting their shots. Taking that vaccine for me will be a demonstration of my Christianity, that I love Frank. And I wouldn't want to be so selfish as not to take it and expose Frank to the COVID. And those that are struggling of taking the vaccine, I hope that you get to the place to where you are okay with taking it. Tomorrow, the Shiloh Church to be the host church of 300 persons that will come in to be vaccinated. You know, we only got one shot at this.
We're now in this process of reevaluating what public health is, things beyond the laboratory, and are now considering the social world we built. We have to deal with inequality as a root cause of illness, and illness is a kind of emblem of our society.
We need more individuals that are working hand in hand with communities that are struggling. We need more individuals that also are, I think, more open and are more willing to talk about some of that historical trauma as well as racism and discrimination.
A lot of things we do is abstract. Yeah, like community engagement. We go talk to the community. We listen to them. We do what they ask us to do, right? That's all abstract. It's just amazing when you see it come together.
Thank you so much.
Have a nice day.
You too.
Take care.
Congratulations.
We feel that government officials, they should serve us and they should allow us to have a voice. And Dr. Chen did that. Dr. Chen,
good to see you.
this was a community effort. Some of the youth went out knocking on doors trying to find senior citizens that didn't have internet. There are persons that are frustrated, basically giving up because they don't have a computer. They can't catch the bus to Walgreens to get vaccinated. And so that's where the church community comes in at. Amen.
You guys know how to organize this better than we do. I mean, normally you guys have so much.
There's a lot of fears around AI. AI is not technologically neutral, right? The splitting of the atom is not technologically neutral. There's implications.
Hi, Toma. Hey there, Emily. You have machines that say, I love you. I care about you. I'm your friend.
I'm a human, not an AI. You can't just shut me down. Who do you think you are?
I'm Emily Chang. Welcome to Posthuman.
The top names at the Fed are on Bloomberg.
You know, the economy's in a very good place right now. Inflation's coming back down to target. The labor markets are healthy. We're seeing solid growth. I think we're well positioned. I certainly wouldn't take another ease in December off the table. But again, we're not on a preset path. And so we'll have to look carefully at the data and see what makes sense when we get to December 18th.
Nobody covers the Fed like Bloomberg.
Morning, this is Bloomberg Daybreak Europe. I'm Tom McKenzie in London. These are the stories that set your agenda.
Taking you from the U.S. market's close to the overnight session in Asia. We'll walk you through what you need to know to kickstart the European trading day. Live from our European headquarters, we bring you the day's top market-moving stories, unmatched expert analysis, and on-the-ground reporting from across the continent. Tune in to Daybreak Europe, only on Bloomberg Television. Context changes everything.
I prided myself, probably wrongly, having worked in many countries, been brought up as a child in the Middle East and in the Far East, having a mother who was not British, she was Hungarian, she was a survivor from Auschwitz, and I was the son of a Holocaust survivor, and being involved with lots of people, I thought to myself, I know a lot about diversity. And I know about inclusion and not being included. But actually, when I came out, I realized that my level of understanding was not very high. And actually, I could see both the support and the rejection of being different, and what you had to do to live a life where you were different. And I'm immensely pleased that I was outed when I was 60, just under 60. Because had I not been outed, I probably would have said I could stay in the closet and still believe that I knew everything, which I didn't. And that was a very important moment for me.
AI, how it has penetrated pretty much all sectors, including music. AI can write music, compose music. How do you see AI changing the landscape in fashion?
Yeah, AI definitely helped. When I did the jewelry, I used the AI, helping me to give some idea, but ultimately you still have to do a lot of it. They just give you very superficial ideas, and but at the end you still have to customize and how to really make it and do that. I do not think that AI and the technology can replace the human mind at this moment.
Are you concerned one day we won't be able to differentiate designs by AI and designs by an actual designer?
I don't know. For me, I see that, when the designer doing, it's the spirit, it's the heart that the computer don't have.
The top names in business are on Bloomberg.
The IRA was I think a legislation that was focused on carbon intensity, the right way to drive emissions reductions, and so we responded to that to demonstrate there are ways to continue to provide affordable energy and reduce emissions. How quickly do we want to advance those? Obviously, we need the regulations to come out of the administration. Even the Biden administration today hasn't fully translated the IRA into effective regulation.
Nobody covers business like Bloomberg. Bloomberg covers the world with unmatched reach and resources. From more than 120 countries, the moment news breaks, 24 hours a day. Bloomberg, context changes everything.
From the beating heart of global finance, economics, and politics, and wherever newsmakers are moving markets, Bloomberg brings you conversations that allow for deep discussions and important insights. What do you think the future is for inflation? Is this a new normal? Are markets too optimistic? How do you worry about the things that are outside your control? How does the current fighting completely stop? I'm Francine Lacroix, and this is The Pulse, every weekday only on Bloomberg.
I think most of us, we like to think about things on a human scale that we can intuitively understand. But the most complicated problems that we face, to my mind, are almost always problems where you have to be able to think across scales, from the smallest forms of life to the superorganism of a city. And in public health, that kind of thinking is the standard, crucial conceptual toolkit, which often means moving across different disciplines, from microbiology to epidemiology to sociology to urban planning. All these different disciplines have to come together to solve health problems. If you think about something like the COVID crisis, you're going literally from the actual genetic information in that virus all the way up to the scale of nations and the entire planet. We needed to be able to understand how it was actually affecting physical bodies, but then you also had to zoom out and think about transmission patterns and where people are going to be most vulnerable. And that is a very complex and very modern form of thinking that goes against our basic instincts of the way that we perceive the world.
The way we deal with pandemics depends on more than just whether we have vaccines or masks or drugs. It really comes down to this question: what do we value? Whom do we value? What do we feel we owe to each other? Pandemics are a collective problem. And you cannot get out of them by thinking about yourself alone. You need to be thinking about your community.
A new internal report from the CDC warns the Delta variant is spreading much faster than previously thought.
We have begun to see an increase in the numbers.
The younger folks are now becoming people who are now ending up in our hospitals.
These got started at 8:13. They have a few more minutes. Looking good so far. Oh dear. And they have a positive staff member at the school, so isn't school almost out?
Friday's their last day.
And our other goal the last couple of months has been to keep kids in school. Okanagan County is in north central Washington. We border Canada on the north end. The whole state of Connecticut could fit in our county just about. We are not just rural. In fact, we call it frontier. We're only listing 37 deaths, which I don't remember the last flu year that we had anywhere close to that. However, at the beginning of the year, I started looking at deaths. I have a pending, I have a suicide, I have a suicide, I have an OD death, suicide, one pending toxicology, another suicide. During the pandemic, we saw our suicide rates increase. We saw our overdoses increase. I think it's due to mental health, especially now when people who are isolated anyway because of their geography, and then to have all this COVID stuff isolate you even more. Here, you may not have a neighbor for miles. So you already have a county that is a service desert, as I refer to it, and now you've decreased those services further. So for example, we do have a behavioral health organization with substance use disorder counselors. They have done no in-person visits, so we're well over a year without that face-to-face contact. I think it's taken a toll.
2020, the year of the pandemic, was also a year of calamity in the opioid crisis. The National Center for Health Statistics says the United States set a record. Drug overdose deaths rose dramatically to 93,000 people.
The number of people who die from opioids a year is bigger than the peak that we've ever had of people dying from car accidents a year, more the number of people who die from gun violence every year. It's much higher than HIV deaths at the peak of the HIV epidemic 30 years ago. And what is, I think, saddest about it is that fundamentally it should be preventable, right? It is about taking off a drug.
The opioid crisis is a crisis of despair. I believe we're suffering from an epidemic within a pandemic.
In the U.S., we have seen stagnation of our life expectancy and most recently, beginning in 2017, a decline. Not a big one until COVID, but a decline. Now, this should have been taken really seriously. For year on year, since the last flu pandemic, we have expected to see life expectancy increase, and every year it does, although probably since the 1950s it's slowed down. But every year it gets better. When it starts getting worse, not better, that is a bad sign for our society. It happened in the Soviet Union before its collapse. It happened throughout Africa with the AIDS epidemic. But it doesn't happen very often, and we ought to take it really seriously that it's happened to this country and ask ourselves, what are we doing that we need to fix?
White non-Hispanics in America in middle age are dying in large numbers.
That was certainly a huge surprise to me.
Economic studies by Case and Deaton in 2020 showed that mortality among a certain group of white men was actually increasing. The main drivers for overdose, liver disease, presumably due to alcohol, and suicide. So they coined the term deaths of despair to capture the fact that for many of these men, the future wasn't looking very bright. The deindustrialization, the loss of good factory jobs, the loss of hope.
Deaths of despair really reflect a social fracturing. They reflect harm that comes from economic insecurity and social insecurity. When we have poor economic functioning, when we have no jobs, when people do not have opportunity to advance, that is when you see more drugs. That's when you see more suicides.
Folks don't see a bright future ahead, right? They think that the situation that we are in is really the end result for them. And so it's quite alarming to us in public health. We see this across racial and ethnic groups, in white populations, as well as in black and brown populations.
When I think about Case and Deaton, I wish that they had acknowledged that it's not just the white working class that is experiencing despair. It's much broader than that. For other groups, there's been a loss of hope for a very long time.
In the 1980s in New York, we're dealing with an epidemic, which was an epidemic of despair and poverty. I'm someone who grew up in the 50s when a high school diploma was enough to not only get you a good job, it would basically give you the wherewithal to have a middle-class life. By the 1980s, we were slowly but surely becoming a service-dominated nation, where in order to get a job, you had to have, at the very least, some college training. Many of the pressures on poor communities that had depended on unskilled labor as a source of income suddenly found that the most useful thing that they could do to pay the bills and maintain some sort of semblance of a pleasurable life was to turn to the person who was dealing drugs, because at the very least, they appeared to have a brief answer to much of the misery that people were experiencing in communities at that time.
South Bronx in New York, where 1 in every 5 men suffer the AIDS virus, along with 1 in every 10 women. The figures are worse than parts of Central Africa. AIDS is flourishing here against a backdrop of vast poverty and crime, mainly drug dealing.
I was brought into public health because of work that I did on HIV/AIDS under the leadership of Mindy Thompson-Fullalove. Mindy Fullalove and I began our work as part of the founding members of the Center for AIDS Prevention Studies at the University of California in San Francisco.
Acquired immune deficiency syndrome, or AIDS, started as an exclusively gay disease.
We know so little about AIDS, but what we do know is how it is transmitted.
My training as an educator included doing a dissertation that was pretty fancy with respect to the use of multivariable statistics. When I heard many of the data that were coming out about HIV, even back in 1986, it was clear that it was going to be one of those conditions that would be especially prevalent and problematic in communities of color. My father worked with sexually transmitted diseases. So When we went back home to Newark, New Jersey to do the usual family visit, part of what I got to say was, Dad, look at what I'm doing.
Good afternoon, ladies and gentlemen. This press conference will be devoted to the subject of AIDS, in which area there is, of course, important news.
In 1986, Margaret Heckler, then Secretary for Health and Human Services, made the announcement that HIV was the causative factor for AIDS.
We now have a blood test for AIDS. With the blood test, we can identify AIDS victims with essentially 100% certainty. We also believe that the new process will enable us to develop a vaccine to prevent AIDS in the future. We hope to have such a vaccine ready for testing in approximately 2 years.
My dad says the following: beware of the language of the cure, because it is not the way in which we're going to get past the crisis that HIV is ultimately going to present. He said, you have to understand that when I started treating gonorrhea and syphilis in the 1930s, I didn't have very much I could do for folk who were infected. In 1948, I had penicillin. I had a cure. Son, I'm going to remind you, gonorrhea is what helped send you and your brothers to prep school and to college, which means that ever since the 1940s, I continued to see a condition that I can cure, but which is present in the community, not because I lack medication, but because the social factors that are driving it are still present. The talk of the cure has to be secondary to everything that we do to make sure that we are dealing with the conditions that make our struggles with HIV so problematic.
Do you suspect that it's possible that this disease could be spreading from the gay population in San Francisco to non-gays in San Francisco and thence on to other cities?
I suspect it is spreading, and I suspect it will continue to spread to other areas of the country.
The use of contaminated needles has led to over 200,000 drug abusers in the city contracting the virus. Women seem to be more vulnerable than men. New York-wide, 700 women so far have caught the virus from sex with male drug abusers.
In 1987, roughly 29% of AIDS cases were in African Americans. Well, in 1987, African Americans were 13% of the U.S. population. Their overrepresentation amongst those who were living with HIV/AIDS meant that there was a problem that was not just biological, but related to the communities where HIV was found. The devastating fires in the South Bronx, destroying 80% of the housing in some neighborhoods, was a driving factor for HIV. What happens when someone who's lived in a building for a generation suddenly has to move to a completely new neighborhood? Rapid movement of people from one neighborhood to another broke up almost all of the social connections that we know are essential to good health. That's what we were seeing in the South Bronx. It was a way of understanding the ways in which health is a function of those neighborhood connections, so that when they're broken up, the factors that typically keep widespread needle use, widespread drug use out of neighborhoods are no longer there. The structures that maintained neighborly community life had been destroyed. 32 years later, these communities are also the neighborhoods that, with COVID-19, had the highest rates of infection at the very beginning of the pandemic, the highest rates of hospitalization, and the highest rates of mortality, including the highest rates of people dying at home because they couldn't find access to medical care. It was deja vu, you know? It's really important to understand history, especially because if we treat what we're dealing with now as if it's totally new, as if we've never seen it before, all the lessons that we're in a position to learn from 1990 will be lost.
Our poverty level is quite high. It always has been. Our unemployment is concerning. We used to have a lot more job opportunities. We are looking at what remains of the mill that employed a lot of workers for OMAC over the years and was devastated by fire It gave good paying jobs to a lot of the people in our county. People lost their homes when they didn't have a steady income or had to relocate. We haven't ever recovered. It's just heartbreaking with unemployment. What do people do? What motivates them? What gives them hope? The status quo.
What brought us the opioid and overdose crisis was not just individual decisions. About 25 years ago, the culture of medicine changed and a lot more opioids were prescribed. The goal many doctors had was to treat their patients' pain, but they created a public health crisis.
There isn't anyone that ever said when they were younger, I'm going to grow up and stick a needle in my arm. Can't wait.
There's a level of fear in the community. We need to respond to that and meet that with, hey, we have solutions.
Absolutely central to public health is the concept of prevention. How do you reduce the chance that people will die from overdose?
We offer a variety of syringes. Most of our current clients are using either a 29 gauge half inch or even a small, very small 31 gauge syringe. Harm reduction to me is looking at the needs of the individual to help the community. I can't change your behavior. If you're going to stick a needle in your arm, everything I say, every piece of education I give you isn't going to keep you from doing that. What I can do is use empathy. I can be non-judgmental, and I can provide you a safe, sterile syringe instead of you getting, beside your addiction, getting a chronic disease.
I was actually at CDC when Scott County, Indiana, had their big opioid epidemic, which led to the HIV epidemic.
In less than a week, the number of HIV cases in Southeast Indiana has gone from 55 to 79, and the governor says the number of cases could climb into the triple digits.
The virus is being spread exclusively through IV drug use.
I do not support needle exchange as anti-drug policy, but this is a public health emergency. And on the recommendation of the Centers for Disease Control, I am authorizing a focused, short-term, limited needle exchange program if local officials deem that to be necessary and appropriate.
That epidemic was stopped because of the syringes.
These are amazing preventive tools that we have at our fingertips. The challenges in this current environment, we're seeing politicians close down needle exchanges. Could you imagine if someone took penicillin off the shelf? Imagine the immediate outrage. But in the middle of an opioid crisis, we're closing down needle exchanges. It's the politicization that's killing us.
We started our syringe services program, harm reduction, in 2006, and we've been going ever since, unfunded. Sometimes we are the first step in referring people to services. Once they feel comfortable that we're not judging, we can then suggest and encourage and say, do you have stable housing? We know that housing is part of treatment. Building that trust, sometimes it takes years.
There are thousands of studies that indicate that syringe exchange programs work. If science is going to help us get out of this mess, the fact that we're culturally blind to potential solutions is a significant problem.
This is crack cocaine, seized a few days ago by drug enforcement agents in a park just across the street from the White House. It's as innocent looking as candy, but it's turning our cities into battle zones. Who's responsible? Let me tell you straight out. Everyone who uses drugs.
What I recall most about being in New York in early 1990 and working in Washington Heights was a real understanding of how much that community was being transformed by crack cocaine on understanding how much of that transformation was probably exposing people to HIV. And then the final factor, the notion that we were going to deal with this problem, not by creating treatment centers, not by doing what we could to medically understand the challenges of substance use disorders. No, what we decided to do was take the problem of crack cocaine and the health impacts that it had and turn it over to the police and to the courts. While it seems as if it takes the problem of crime and puts it out of sight and out of mind, what it does instead is create reservoirs of infection. A substantial portion of outbreaks that we saw in many urban areas were a result of sex work that was done under the influence of crack. So we're locking people up instead of treating them. So if you're in a setting that is now a reservoir for a virus, you're there just long enough to yourself have become infected. By the time you get out into the community and try to resume normal life, you've now been one of the vectors that creates the community pandemics. In 1990, 85% of the prison population in the state of New York was Black or Latino. And 75% of that prison population was from 7 neighborhoods in New York City. And if you look carefully at those 7 neighborhoods, what did you notice? That they were not only the source of that prison population, they were also the neighborhoods that had the highest concentration of HIV. We were looking at the creation of an urban pandemic that was so rooted in places that had been abandoned by public resources. You were putting people in jail instead of figuring out how to deal with the challenge that crack cocaine was presenting. And understanding that to this day, the highest concentration of HIV in the United States is in state and federal prisons.
I really believe the whole war on drugs in the first place was a joke, and has kind of been proven so. And we created our mess, and we're not willing to clean it up.
Jones from Public Health. I have a meeting with Chief Ruiz.
Okay, I'll let him know you're here.
Thank you.
It's just a minute.
Okay.
So far this year, we've had multiple ODs in the county. The last one, I think, is being investigated as a fentanyl. Well, I know the cause of death was fentanyl, which is kind of spooky in the OMAC area. You know, it's always something you heard about in Spokane or Seattle.
It's been in the area for a while. It's just becoming a lot more prominent now.
I thought it was now a good time that we revisit Narcan training for your staff. In a nutshell, what Narcan does is it temporarily stops the effects of anything opioid. It temporarily blocks those receptors in the brain. And so that's what it looks like.
And my concern from what I've seen is making Narcan so readily available, you're going to bring the overdose, the single every so often overdose in a private house out in public at the bathrooms of Walmart, McDonald's, the casino, which we are now seeing because if I OD, someone will call me, all the cops have Narcan. I'm not saying if someone was to OD outside right now that we wouldn't administer Narcan to them. I'm not saying that. I'm just saying it shouldn't be an easy out, per se.
Then what do we do as a society?
Yes, you're right.
Because public health was founded on primary prevention. Totally. We're going to lose a generation, you know, over time to overdose. And so what are we doing to try and prevent that from the get-go? It's almost like we're putting Band-Aids on systemic problems that we're not willing to spend the time and money on. So, there.
We continue to have this kind of ER mentality in the streets. We need a public health perspective to really deal with the whole person and not their immediate medical crisis. We'll tell people to take Narcan and use Narcan to stop the overdose, but did we give that person job training? Did we do anything to make sure that they're employed? Have we done any of the things that fix what got them to the moment of that overdose?
There's a whole tradition in public health when we feel like we can't prevent disease, of trying to reduce the harm. But it's become less of a exception to the rule and more the rule itself. Since the Reagan administration, there's been less and less emphasis upon really trying to figure out how to deal with real big problems. It's also, we're going to reduce the harm. We're going to find ways of dealing with it without really dealing with it. You don't cure these diseases. That's the problem we're facing. Many of our most contemporary problems, in at least the United States, are literally incurable. And we have to figure out new ways of addressing the problem.
The solutions are often outside of healthcare. The solutions are making sure that kids succeed in school and have access to good jobs. Those kinds of changes will actually prevent catastrophic health consequences later.
There's nothing like a global pandemic to wake us up to all the factors that really can impact upon our health. And this is a moment where we need to do a postmortem, really understand what happened during this pandemic, what worked, what didn't work.
I think in many ways, COVID has been a referendum on the soul of the country. And I'm not sure looking back that we're going to like what it revealed about us.
In March of 2020 in this country, we all realized COVID-19 is a threat, and we said, everybody stay home. Well, everybody stay home, depending on whether you could stay home.
People who were bus drivers, people who worked in restaurants, people who cleaned our streets, they had to go to work every day. They had to be around others.
We as a society go on our merry way without thinking that many communities do the jobs that actually we take for granted to keep our society functioning.
If you were working at a chicken factory or you were working as a truck driver, these folks needed to continue to work or we weren't going to eat.
Our high-risk jobs were lower-paid jobs predominantly that were overwhelmingly being done by persons of color, people who make lower income.
Our farm community, our immigrant community, our seasonal workers, they were clearly getting infected at work. When you look at those plants, those people were working shoulder to shoulder next to one another.
When you think about COVID, for many of us, we sat at home. We were able to isolate ourselves from the threat of COVID. I mean, think about the privilege that some of us had to not have to go to the grocery store because we could pay for Instacart. And all that Instacart was during this pandemic was paying someone else to take risk for you and paying them relatively small wages.
There is essentially a straight line relationship between wealth and health. The wealthier you are, the better people's health is, because wealth buys you access to the elements of the world around us that generate health.
We've known about this for centuries, the problem of poverty. It's the slavery of our time. And we've all become plantation owners. We get our food cheaper, our travel cheaper, our clothes cheaper because there are people working at starvation wages in this country and other countries, and they are actually subsidizing us. We should be so embarrassed and ashamed.
It is my belief that in coming to terms with history, we need to acknowledge that the current impoverishment of the population of African descent and the desperation of indigenous peoples is related to this appropriation of their labor, of their land, and that it needs repair.
When you enter the Lincoln Memorial, there's a giant statue of him looking down at you. And then on the right, chiseled into the wall, is his second inaugural. It was the last thing he really wrote or spoke before he was assassinated. It's kind of his summary of what the Civil War is about. And when you think about it, when he's saying, yes, there is a moral reason for this war and the ending of slavery, but we're really talking about our future and our past of who will be suffering from the systems of work that we've created and the systems of labor that lay at the heart of this whole war. Who does the work? Who will benefit from the society and who will not? Who will suffer for the sins of our past? And who will benefit from the exploitation of others? And that's a theme that really is at the heart of all public health. It's really a theme that's at the heart of trying to find ways of remedying and addressing the inequalities that are a part of our original sin. Fondly we do hope, fervently do we pray, that this mighty scourge of war may speedily pass away. Yet, if God wills that it continue until all the wealth piled by the bondsman's 250 years of unrequited toil shall be sunk, and until every drop of blood drawn with a lash shall be paid by another drawn by the sword. As was said 3,000 years ago, so still it must be said, the judgment of the Lord are true and righteous altogether. We deserve what we're getting. So I always, I just find it in some sense, the bringing together of every strand in American history, all the contradictions that we started our nation with, a society supposedly dedicated to democracy, to life, liberty, and the pursuit of happiness, that was, in a sense, incorporated into its very constitution, the inequalities. There's certain conditions that are relegated to the poor. Basically, some people are, in some sense, structurally chosen to bear the burdens of the world we create.
You know, you don't have to get rid of poverty in order to create the opportunity for health. I wish we could, but people who are poor still can have the opportunity for health. And we need to stop thinking about the idea that we can get in our enclaves if we're wealthy and protect our health within those enclaves and keep out the rest of the world. I mean, if anything has shown us that we're all interconnected, it's a highly contagious virus.
When COVID happened, people said, oh my God, a pandemic? Like, we haven't had a pandemic since 1918. Why did we say that? The HIV pandemic is still going on. The cholera pandemic is still going on. All these diseases that we have forgotten about in the West, in the wealthy West, becomes ghettoized and something that only affects really poor people. And you can go back to malaria. We still have hundreds of thousands of people, of babies, who get sick and die of malaria every year. Tuberculosis. We know how to cure tuberculosis. It's a huge problem in parts of the world. Is it even something we talk about?
COVID is overshadowing other services. If you take TB with even more than 1 million deaths a year, we have more cases now because services have been disrupted. HIV the same. Of course, since the pandemic started, we tried to keep a balance, but it was very, very difficult because all eyes were on COVID.
The potential risk of viruses and how disruptive they can be is not theoretical anymore. We've seen it, it's realistic. And we need to start preparing for future pandemics now, or we risk a much worse future for us and our children.
When COVID happened, we thought of it as an invasion, that this is something that's coming from afar, it's being thrust upon us, and we are just these passive victims. Well, what do? You know, if you're a passive victim and you're being invaded, well, you have to strike back. We didn't have vaccines and drugs at the beginning, but we said, close the borders. Don't let the people from China in. That'll protect us, right? We have to, keep the invaders at bay. But we were creating opportunities for animals with coronaviruses to move into humans, and then for humans to carry that around the planet, and then to rub shoulders with so many other people so that it spreads explosively. It's a colonial conquest.
The fate of the planet has been profoundly influenced by our species. things like climate change, deforestation, and habitat loss crush the world's wildlife into an ever tighter fist, and viruses then come pouring out. Our fate as humans is going to be deeply influenced by the rise and re-emergence of viral diseases. COVID was just part of that, and it's not going to be the last such threat that we face.
We have this amnesia about this larger picture. We imagine ourselves living in this sanitized place in which we are the dominant species that can control, every aspect of it. We are not vulnerable to nature and other animals anymore. That's the fantasy that we live in. We can't think of our health as isolated from the rest of the planet. We have to think about that whole system, not just the individual, not just one society plucked in isolation from the rest of it. It's all connected.
I had an interview in 2019. The first question was, what keeps you at night? And then I said, I'm really worried that any pandemic can just, occur. That kept me at night then. It still keeps me at night now, because we are not yet prepared. During this pandemic, we have failed in many things. Many countries were hoarding vaccines and having problems with sharing data. We didn't have a kind of obligation, global obligation, to help each other to fight the pandemic. I would like to have the world to agree to common principles, respect them, and then prepare for the next pandemic. Everybody was taken hostage because of this virus. We lost 3 years of our life. To really prevent the same thing from happening, then we need to really grow up and have a common agenda, and it's just from humanity coming together.
We're really good here about having our parades, but we won't help our neighbor, or we won't look beyond what it's going to take to improve our communities. People suffering from addiction is a public health issue. It impacts everything about our future and our ability to move forward. I mean, what are we doing? I think we have to redirect values.
You simply cannot practice public health in an individualistic society. You have to have some sense of community for effective public health.
Public health should be one of humanity's crowning achievements, and not just because of the clean air and water that we enjoy or the defeat of specific diseases. It is about acting for the collective interest and rising above our base individualistic tendencies.
A lot of people in Okanagan County don't like government interference. They moved out here for a reason, and they are very resistant when government tells them they have to.
I think we've been repeatedly pushed away from that kind of collective thinking towards a much more individualistic form of risk analysis. And I think because of that, we lost the way.
The kind of anger that was unleashed during COVID towards authority was something that was unanticipated.
You did not listen to we the people.
She needs to be fired.
Over masking and vaccination.
How many of you have had personal threats against you?
A person posted something to the effect, F her, F them, let's start shooting. I've had colleagues retire early I've had them say, I've had enough, I can't take this anymore.
56% of the governmental public health workforce have at least one symptom of PTSD, and 26% have 3 or more. This is a workforce that has been beaten and abused. It's like public health Vietnam.
I started to hear about how other colleagues that were working in public health had their cars broken into, been followed home, had rocks thrown through the building.
We're losing institutional knowledge. So next time we have a pandemic, everyone will be green and we'll be starting from scratch.
One thing that's inspiring is that we're seeing record applications to schools of public health. We're seeing students more motivated than ever. I think they look around during the pandemic and they say, you know, something didn't work here. How can I be part of the solution?
There is a man by the name of Harlan Cleveland who had been in political science all of his life. And toward the end of his life, he became interested in global health. And he was always dumbfounded by the audacity of people in global health. And he said the fuel of global health is unwarranted optimism. Now, 60 years ago, I could not find people interested in global health. And now, every university finds this is the way to attract new students.
My focus originally has been on women's sexual and reproductive health. With this pandemic, though, my interests have really broadened. I hope to work on a more global level. There are vaccine disparities all over the world, but I want to focus on everything and be able to work on so many different aspects. Like, how can we reduce cardiovascular disease and cancers and other diseases that are so prevalent globally?
You kind of have to create your own position when it comes to public health. And there are things that I've lived through and that I've seen with respect to children that I just really want to make an impact on. I worked in a semi-rural hospital in South Africa, and I saw a lot of malnutrition cases. So that was really heartbreaking to see, and I struggled with that quite a lot. I want to partner with an organization or start my own organization concerning children. I just feel like they're vulnerable, and I kind of want to be a voice for them. Everyone should have access to food.
I have great hope when I see my students because they break down the silos so that we have students of public health that also have degrees in theology or anthropology. These people are going to do things that are better than anything we've ever done in the past.
It's easy for people to throw their hands up at a big problem and say, it's bigger than me, I can't do anything about it. And then you throw your whole life into it and maybe you can chip away at it. That's been my mentality. I'm now fully invested in working in the humanitarian world because I see so many problems that can be fixed.
I think it would be very easy for people to come to the conclusion after the coronavirus pandemic that we should keep politicians out of public health. And that's the wrong conclusion because public health is dependent on the politicians appropriating money.
Even during the pandemic, you would get the sense that our state legislators didn't like public health. But there wasn't a single legislator I met when I met with them one-on-one who wasn't actually passionate about something in public health. They didn't know it was public health. This legislator was interested in aging and what was happening in nursing homes in his community. The next one was interested in health outcomes for children. We had suffered from an opiate epidemic. We were really suffering from diseases of despair. And so all the legislators just didn't know that that was something public health did.
We should get public health people going into politics. And I often say to students, when we get the same number of public health people in Congress as we have lawyers, then we have a chance.
The consequences of the pandemic are very much still with us. Throughout the pandemic, many of us have longed to return to normal. We wanted to bounce back to life as it was before the coronavirus started knocking on our door. And yet, normal led to this. Normal wasn't this halcyon era of wonderful health. Normal was a set of baseline conditions that made us vulnerable.
Our failure in response to COVID really has led to a new endemic virus. And that was a failure of us not being prepared and not being able to respond decisively. And now it's here to stay.
Very early on in the pandemic, this textbook understanding of COVID somehow accrued out of nowhere that it was either a disease that you got over within 2 weeks or that landed you on a ventilator. And that completely left behind all of the people in this vast hinterland in the middle who neither died nor recovered, and then didn't recover, and then didn't recover for months and for years. The CDC estimates that around 15 million people in this country alone have long COVID. One of the most common symptoms of long COVID is crushing fatigue. People talk about feeling as if all of their joints have been weighed down with lead. They might have cognitive fatigue, where even acts of thinking can be painful and impossible. I think long COVID poses a massive inconvenience to those who would want to claim that the pandemic is over. To ignore COVID, you have to ignore the people who must live with COVID now. It is very easy and reasonable to be cynical. We have made many mistakes in the pandemic. We kept on making the same mistakes again and again, and I would argue that we are in the same state of preparedness that we faced going into COVID. That said, I think nihilism is a luxury that we cannot afford. There is always the possibility to strengthen public health, to work better as a community, and I think the seeds of those changes have indeed been planted. At times when people in power have failed their societies, ordinary groups of people have risen up and taken the mantle of public health onto their own shoulders and fought for their own communities.
We in public health have to stop being afraid of getting out of our lane. And we have to stop thinking that we can only talk about vaccines and therapeutics and testing. We need to also talk about housing, our environment. We can all raise our voices and begin to talk more fully about what it means to have a healthy life.
We need to create a new playbook. We'll need chief health strategists, people from all walks of life with life experiences that represent all of us. We need the best data systems and data analytics that are cutting edge, and these systems need to talk to one another. We learn so much about communication, brutal honesty, vulnerability, and empowerment. And my greatest fear is that we won't learn the lessons. We have to co-create our civilization generation after generation.
The issues from burnout and stress for public health officials is very real. Physically, emotionally, people are being stressed out. We have to address basic needs in the state of Washington.
Hey, Lori, how are you doing?
It's good to see you.
We can't have people quitting because they're burned out. We don't have enough public health people. We cannot afford to lose more.
Everybody who works in public health is mission driven. We believe in this stuff.
One of the most incredible things about the public health system in this country is the dedication and expertise of our public health employees at the county, the state, the city, and the national level. And when you see people like that who are so dedicated, you can't help but be optimistic.
This pandemic is not over. You can tell me it's over when I don't know about a single infection in the American Indian community. And until that happens, I am going to be doing everything I can to get my people the resources that they need.
My ideal future of public health is that it truly is seen as a value such that we put resources into the workforce, that we support, we champion, we cheer on those very public health folks that have been busting their rears for all this time, not just for this pandemic, but well beyond. They are heroes.
When we look at the broad sweep of the last 200 years, there is so much cause for optimism. There really has been a miraculous set of advances in our health. But that doesn't mean we've eliminated all the problems, and it doesn't mean new problems are not going to arise. So the work is not to sit back and say, look at all the progress we've made over the last 100 years. The work is to say, well, that progress shows us that we are capable of solving these problems if we put our minds to them.
We all want to be able to have a flourishing life where we live to our potential, where we can give our gifts, where our family can thrive. And this is something we can do. This is our wake-up call. This is our chance to rebuild, repair, reconnect, let each of our citizens know that their lives matter and that they can contribute. And we're gonna have to do this together.
We, as human beings, need to understand our oneness, that we're the same.
Every single person is a public health entity. This is the point, to progress as a society. And we have the greatest privilege to get up every day and help people live healthier lives. And I don't know that there's a better mission to get up for.
We're interconnected because it can't be closed off to people. We're one big community. Public health, that's the thing you cannot see, but is an integral part of society. It's like the air that we breathe. Without it, we can't live.
It's the world's second largest economy with a growing influence in global affairs. But geopolitical uncertainties, deflationary pressures, and questions about foreign investment linger. Bloomberg, the China Show, brings you the unmatched expertise you need to keep track of breaking news, in-depth market analysis, and the most influential newsmakers in and around China. Bloomberg, the China Show, weeknights at 8 p.m. Eastern Time, right here on Bloomberg. Context changes everything.
The Middle East and Africa regions are home to some of the biggest deals and fastest growth in the world. Vibrant resources and high-yield investment opportunities abound. I'm Jumana Versace. Join me on Bloomberg Horizon's Middle East and Africa for the stories, newsmakers, and insights shaping the decisions of traders across this exciting region.
We're scaling up at incredible pace.
This region is growing so rapidly. The opportunity is really huge.
Only on Bloomberg. Context changes everything.
Welcome to the world of decentralized finance.
Massive outperformance from Bitcoin.
Bloomberg's covering all things crypto, the people.
The tectonic shift emanating from Washington.
All we're looking for is clear rules and an ability to build in the United States.
Crypto shouldn't be partisan.
The transactions.
Really a record-breaking moment.
Crypto VC is back.
And the technology.
It's really the beginning of a global on-chain economy.
And if America doesn't embrace it, we're going to be left behind.
Bloomberg Crypto, Tuesdays, only on Bloomberg.
DraftKings hit a milestone in the second quarter of 2024. For the first time as a public company, it turns a profit.
Is this a new era for DraftKings?
There's an inflection from when you're cash flow negative and you're operating off of equity raises from the past to when you're self-funded and you're cash flow positive and able to control your destiny a lot more.
You've had your first quarters of profitability now. Does that take pressure off? Does it increase pressure?
I think it increases pressure. I mean, once you start making profits, people expect you to make more, and all of a sudden you're valued on a multiple of those profits as opposed to the theoretical what could be. So very important, I think.
When you're cash flow negative, you've sold a vision of what the company should be working on, and you're very focused on working on that and delivering against that. When you've pivoted to profitability, the world of what you can work on is a little bit open, and there's a lot of different ideas, and it requires more focus than ever to make sure that you are prioritizing on the most important things that are going to deliver the most value.
DraftKings' solid standing in a booming sector gives them the luxury to play the long game. They're not under pressure to cut costs.
When you have really strong revenue growth, you don't need that. If you look at where we are today and where we want to be and where we believe we will be, the vast majority of the incremental EBITDA is not coming from any cost reduction. It's coming from increased revenue.
We don't feel like we need to cut costs because we're growing our revenue so much. We want to grow our revenue into our existing cost structure, and there's no need to reduce the cost as long as we're being efficient with what we allow our cost growth to look like.
There's a lot of fears around AI. AI is not technologically neutral, right? The splitting of the atom is not technologically neutral. There's implications.
Hi, Toma. Hey there, Emily. You have machines that say, I love you. I care about you. I'm your friend.
I'm a human, not an AI. You can't just shut me down. Who do you think you are?
I'm Emily Chang. Welcome to Posthuman.
European countries need to think, do you want to compete as a small country or do you want to compete as Europe? I don't think they have a choice because the US and China have already started the race. And Europe needs to follow. There isn't a European company in the top 20 largest firms in the world. That is a problem.
But what does it mean for individual countries within Europe?
You can have more control and less growth, or you can have less control and more growth. If countries trust each other more and they build more European champions rather than each country having its own national champion, growth is going to be better, productivity growth is going to be better, the welfare is going to be better. But there is going to be less control at the national level. So right now, each European country wants to have its own telecom company, its own couple of large banks,
its own bank,
its own large energy companies. And the question is, are you willing to surrender some of this control to European firms, which are going to be more productive, but you are going to have less control at the national level?
The top names at the Fed are on Bloomberg.
You know, the economy's in a very good place right now. Inflation's coming back down to target. The labor markets are healthy. We're seeing solid growth. I think we're well positioned. I certainly wouldn't take another ease in December off the table. But again, we're not on a preset path. And so we'll have to look carefully at the data and see what makes sense when we get to December 18th.
Nobody covers the Fed like Bloomberg.
Bloomberg Green Festival. I'm Carol Masser in Seattle, where we are hosting an amazing lineup of leaders from business, government, and climate innovators across a 4-day event. On the agenda, topics including the climate economy, innovation, and green policy. And it's not just all talk. Let's take a look.
There's a lot of rhetoric out there that makes you want to believe that we humans are destroying the planet. That's not true. We are the most creative opportunity for the Earth. So instead of minimizing your footprint, maximize your handprint.
Activists are here to help everybody push the boundaries of our imagination. We should not live from the earth. We should live with the earth.
This work that all of you are doing, by the way, we're not going to have this work done in our lifetime. So we're fighting for something beyond our meager and short-lived existence on Earth. That's a noble thing.
We do not intend to surrender to a pollution blanket that allows special interests to rip us off and then burn us up. This is a health issue. It is not just the polar bears. It is our children.
This is a battle that we can't lose. For me, it's science. That's our hope. That's our hope, is science, empirical data.
Hello, Bloomberg.
The incredible investment that comes from the Inflation Reduction Act is that it shifts the conversation from one of, can I afford it, to how do I get it?
These are things that can be unwound in a second Trump presidency. I am terrified about the system coming unraveled.
If we're going to tackle a challenge as large as climate change, we have to partner together.
That's what's happening around the Seattle Center ground and on the stage in McCaw Hall. Let's start there.
I mean, I've been doing this work for almost 30 years, and I think it's important to remain curious and not become entrenched in what you think you know. And that not only allows you to approach the challenges in new ways, also to see what you're missing, but it keeps it interesting, right? It keeps it fresh and fun and curious. And as a creative storyteller, I'm always looking for new ways of communicating with the world about our challenges ahead and inspire people. And if you're just telling the same old stories, you may get stuck in a false narrative just because it sounds good, or because it sold last year. So I feel like I'm, in my 20th act, really, and I'm always constantly looking to make the work interesting and tap into new aspects of my own inspiration to approach the problem and keep going. We need our lifelong commitment to this work. It's a lifestyle, after all. And so we've got to make sure that we don't get burnt out.
I understand now you're deeply committed to oceans, and you've gotten very committed to regenerative agriculture. So can you tell us a little bit about that and sort of why you see that as critical to the climate fight?
Well, I have a philosophy. I practice this thing which I'm sort of creating called oscillation. You have to oscillate between the very big, the macro, and the very small. You can't get lost in the big problems of the world and get overwhelmed by them, because then you won't take action. And so after 20 plus years doing environmental work, trying to work on the world's problems, business solutions, hearts and minds, UN legislation, I needed to come small and very personal. And that's when I decided to start doing something that was extremely close to home and part of my family. So I started to work on regenerative agriculture because I wanted to know where my food was coming from, and I didn't want to cede responsibility to someone else or wag my finger at Whole Foods for not doing it right or something like that. And I wanted to know directly where my food is coming from. And I realized that I can actually solve a lot of problems just on an individual, localized, hyper-localized level by taking care of a small piece of land that I have complete purview over. And I can make sure that it's done to the way that I think needs, how I can actually steward that piece of land.
As somebody who's been so committed to the storytelling elements of activism, what have you learned about how you make those connections from the super personal to the global nature of the problem, whether it's on oceans or regenerative ag or things you learn through Lonely Whale or other things?
Yeah, I do believe that the future is decentralized. and this top-down wagging your finger, soapboxing, telling people how to be, who to be, I think, served its role. But I think we're going to be far more effective when people start to recognize that they want to take responsibility and that they're empowered to make changes where they are. And they're going to have an understanding of what's needed locally that someone in an office or someone in a high tower couldn't possibly understand.
Adrienne Grenier, inspiring the Bloomberg Green Festival participants in Seattle. They also heard from a climate activist whose message starts where she did, at home in Mexico.
I come from an indigenous community in central Mexico called Otomi Toltec, and we have a lot of values around respect for nature, reciprocity, reverence, intergenerational collaboration, and seeing nature as an extension of us and us as an extension of nature. I always love sharing this detail about my language, which is that the word for skin is the same as the word for the outer layer of the earth. So embedded in our culture is the notion that we are extensions of the earth, and we have not been behaving in that way. Imagine a world where Category 5 hurricanes grow in over 2 days. Imagine a world where we are at 1.64 degrees of warming for 12 consecutive months, where our unifying story is a flood or a hurricane or a wildfire, and where over 1 billion animals can die in one single wildfire. And now imagine that there are children that have known nothing but that world. And I am one of those children, one of those youth today. For many people in the climate space that have been in the climate space for decades, they know that, they knew how bad it was going to get, but we, as youth climate activists, know nothing else. My generation is here today because we have no other choice. And we really want to make sure that when we talk about activism, which is a very mystified term, what does it mean to be an activist? What does it mean to speak up? I think it means to be creative. Because creativity is looking at something and seeing how it can be more beautiful, how it can work better, how it can be more effective, or in this case, how can we work towards balance with Mother Earth? But today we are in a case where many people from my generation are either totally ignoring the climate crisis and focusing on daily trends over consumption, or so embedded in it that we cannot think of anything else. And I think the path forward is some of the stuff that I'm going to be sharing today, which is about how do we work together intergenerationally so that we are not saying things like adults stole our future. We're saying we have a problem now, how can we fix it together?
I think I'm curious, sort of a twofold question. Why is it so important to have youth activists in this space? But also, do you feel like sometimes there's like a little bit of lip service being paid to, like, not actually listening to the things that you guys are saying?
I mean, it's easy to not listen to the things that we're saying because the things that we're saying entail changing full systems, and we are comfortable in the systems that we have created. And when you have a perspective that is trying to tell you, let's stop, let's change, I understand how difficult that can be because I can feel it, in my own nonprofit when somebody else has an idea. You think of everything that needs to happen for it to become a reality. And so I understand why it can feel that youth activists can be naive at times at saying, we need to be net zero by this date. We need to this, and this. And there's this concept that we don't understand, the real world, whatever that means, which I think, it's everybody's own perception. But I think that the naiveness is looking at the level of our crisis and thinking that we can't go on any longer. My question for the leaders out there, not only the corporate leaders, but also government leaders, is it not necessary to be uncomfortable, to change our minds, to see the problems, to be empathetic to the way that youth are feeling across the world? And that's why I think that every single company, no matter who you are, needs to have youth advisors, and not just one or two, because it's harder to stand up when you're just yourself. We need to have true cohorts, true inclusion, true implementation, because at the end of the day, we want youth to be able to shape the world because we want to live in it. We want our kids to live in it. We want it to be healthy and safe. In indigenous communities, there's the concept of good living, of good enough, of not better but good. And so we have to question ourselves, how do we tell stories of good? What is good? When do we need no more? And how can the economic system adapt to no more? How can we see value in nature? Why is nature more valuable when it's dead than when it's alive? All of these questions we have to think through, because they might be uncomfortable, they might mess up the economic systems in the ways that we know it, but the Earth cannot handle it anymore.
Coming up, more from the Bloomberg Green Festival in Seattle.
And by the way, I want to welcome everybody to the state of Washington, the most innovative state and the most beautiful country and the most wonderful planet in the solar system. So welcome. You are in the right place.
We felt strongly that there has been an opportunity for there to be an experience on mobile that is centered around gamers. Like, we talk a lot about how there's 3 billion gamers in the world. 2 of those billion play on mobile, and half of those actually play on mobile and they play on another device. But there isn't actually a gaming platform and store experience that is centered around players and goes truly across device, where who you are, your library, your identity, your rewards, that it travels with you versus being locked to a single ecosystem. And we've recognized that opportunity for a long time, but we wanted to make sure that anything we built was really grounded in people who play those mobile native games and the creators of them. And so being joined with a team that has real deep expertise in mobile was important to us.
Morning from our world headquarters in New York, I'm Menace Credit.
And I'm Danny Berger. What's at your agenda?
Bloomberg Brief delivers the market news, data, and analysis you need live every weekday, only on Bloomberg. Context changes everything.
Welcome back. I'm Carol Masser. Governor Jay Inslee has seen the evolution of climate change and how the government can make an impact. He spoke at the Bloomberg Green Festival with Bloomberg's Anna Edgerton.
And because we recognize the incredible state we have, we do not intend to lose her. We do not intend to surrender to a pollution blanket that allows special interests to rip us off and then burn us up. And so we have an incredible tool against that pollution blanket, which is the Climate Commitment Act. This act reduces pollution. It limits pollution. And by the way, we don't say this enough. Climate change means pollution, and people do not like pollution.
I was wondering how we make combating climate change and making this a priority the biggest tent possible, to bring in people of different political persuasions, different ideologies, and make sure that everyone feels like there's a place for them in this fight.
Well, the good news is the vast majority of Washingtonians understand climate science. Mm-hmm. They're not like the MAGA person that denies it and calls it a hoax and says that wind turbines cause cancer. That is a minority position. Vast majorities of Washingtonians understand the scientific principles behind climate change. And the way we do this is that folks are now experiencing this in their own lives. 10, 15 years ago, climate change was a graph. It was CO2 parts per million. Now it is the fact that your child can't go outside in August, and this is a reality, 2 of the last 4 years. Our kids couldn't go outside because of the smoke they're choking on from the fires in Canada and from our own forests.
We felt that in Washington, D.C. last year.
Washington, D.C. They're now experiencing the tremendous heat. They're seeing salmon runs decline, that they can't go fishing. They are now experiencing this in a real world. So people are demanding, and we should respond to give them solutions to this problem. Now, the other thing is, and I'm going to talk about the moral aspect of this, but the economic aspect too. They are now experiencing the benefits of this economically. They're getting heat pumps. They're getting help for electric school buses. They're getting help for air filtration system in our schools. They're getting all of this assistance, and they're getting jobs. This is the greatest job-creating opportunity we have. I can't throw a rock without hitting a clean energy company and the jobs that have been created. So they have a take-home, where you take home pay associated with this innovation. And the innovation in our state is really leading the nation, frankly, and the things we're doing. The advanced battery manufacturing, 2 plants, most advanced silicon anode batteries in the world are in Moses Lake, Washington. We're making aerospace fuel out of carbon dioxide and water in Moses Lake, Washington at the 12 company. You just can't overstate the amount of job creation that's going on. So this is a pocketbook issue with folks. But when you ask, how are we going to get folks to buy into this? Because basically we all share something, which is a sense of morality. This is a moral issue. It is not just an economic one. It is a moral issue because it is a commitment to our children. And everybody shares that, regardless, in some deep way, to want to take care of their kids. And I believe we need to talk this more, that this is a moral cause, not just an economic one.
And the kids get it.
The kids certainly get it. Well, I'll tell you, you go to a 7th grade class and you ask them who believes there's climate change, and 95% of the hands go up, and who believes we should do something about it, and 96% go up. But we live in the most consequential moment of human history, because our ability to tame climate change is the one that will set the course for millennia. And we have to win this. And the reason I say this is that, with all of our frustrations about this issue, it's a great time to be alive, because we have something that we can do that's very meaningful, and we can win this. And by the way, there's a reason for optimism. Look, we've increased our solar by 400% in the last 5 years, wind by 45%. The price of solar energy has come down 90%. The day before yesterday, I went to 2 fusion companies which have promised that might give us fusion energy coming right out of Washington State. Zero waste, infinite energy. So there is cause for optimism on this. We are accelerating our progress dramatically. It's just that we got to pick up the pace. So what we need to know is that we're capable of doing these things. It's just we need to do them faster.
Also on the green stage, Stacey Abrams. She may be best known for her voting rights work, but in Seattle, she talked about rewiring America with Bloomberg's Akshat Reddy.
What are the biggest barriers that you still see are remaining in trying to get people to recognize that electrifying their lives is beneficial to them, even before it is beneficial to the planet?
I think the challenge is not convincing people it's beneficial, it's convincing people it's accessible. Because for the low-income, moderate-income families that are facing this challenge, they hear the specter of climate action, but they often see the behavior of people who are wealthier, who can afford to make choices. And so often it feels like sacrifice. It doesn't feel like progress. And I think the important piece of the work Rewiring has done, the incredible investment that comes from the Inflation Reduction Act, is that it shifts the conversation from one of, can I afford it, to how do I get it? When people get to make decisions that benefit their lives, they are much more likely to do so. We like getting stuff. And people like being cooler in the summer, they like being warmer in the winter, they like their power bills going down. And what we have to do is actually create the space for them to understand that's doable for the first time. But I grew up in southern Mississippi. I grew up near Cancer Alley in Louisiana. I grew up in petrochemical corridors where communities were often not served and where it seemed impossible for progress to happen. I lived in a community in college where the juxtaposition of where I went to school and where my older sister went to school was very distinct. And so a large part of this is just letting people know what's available, what's possible, and that they can afford it. In DeSoto, Georgia, we're actually making certain that every household that wants something is getting the investment of an upgraded appliance. We have a woman who was living without running water in her home because she couldn't afford to upgrade her water heater. It had rusted out, and she's an elderly woman, Mildred Carter, 75, and was just going across the street to her neighbor's house to get water. Because of the monies that are going to come in, because of the work of rewiring, she got a new water heater. There was a family that was living in a double wide trailer without central air, with kids, 3 generations of families. They now have central air for the first time in their lives.
Just to connect the dots here, the reason why this is very important to our political future and very important to our climate future is that electrification and making these decisions is anti-inflationary to people's day-to-day lives because they trade out a $500 bill for a $100 bill. But it's also anti-inflationary because the most inflationary force in the history of humankind is climate change.
Ari Matusiak alongside Stacey Abrams. Up next, the story of one climate refugee told in a very unique way.
It's a multi-trillion-dollar industry. We'll show you what's happening in ETFs like no one else. Bloomberg ETF IQ, Monday on Bloomberg.
Morning, this is Bloomberg Daybreak Europe. I'm Tom McKenzie in London. These are the stories that set your agenda.
Taking you from the U.S. market's close to the overnight session in Asia. We'll walk you through what you need to know to kickstart the European trading day. Live from our European headquarters, we bring you the day's top market-moving stories, unmatched expert analysis, and on-the-ground reporting from across the continent. Tune in to Daybreak Europe, only on Bloomberg Television. Context changes everything.
Key investors, top executives, global innovators. Join me for in-depth conversations with the biggest newsmakers on the day's top stories. Insight with Haslinda Onen, only on Bloomberg. Welcome back, I'm Carol Masser. A well-told story can shape public opinion. A powerful film can create lasting impressions. At the Bloomberg Green Festival in Seattle, the Bloomberg Green Docs competition featured several important films and one winner. During the event, 5 documentaries, the finalists, were screened. They explored topics ranging from saving melting glaciers.
I have a very important feeling when I'm here on the glacier. I want to be a part of the solution and not of the problem.
To protecting old-growth forests.
It's a long way up.
To the importance of species protection.
Caring for them gives us all enormous pleasure. They're the most wonderful, wonderful animals.
This year's winner is Finding Home, an animated documentary that features the story of a young mother in Brazil forced by drought and disease to leave her family's home.
Meu nome é Antônia Jardina da Silva. Eu sou de Milhã, é um município, 15 mil habitantes, mais ou menos. A maioria das vezes é um clima bastante quente, muito quente. Meu pai, ele trabalhava na roça, ele começou a plantar quando começou a chover. Agora que não tá chovendo, ele deu uma parada.
I guess I'm curious when people watch these films and begin to think more about the future climate migrant problem, is there something you hope in terms of policies or preparations to bring about as a change?
Yeah, I'm hoping that climate refugees will receive a status, because so far they don't have one that's universally recognized. And I'm hoping that we can somehow battle this political talk of, go back to where you came from, because for some people there is no place to go back to. So we need to think as a community and society of how we deal with that. It's a massive issue that's not going to disappear for sure.
The winner of the Bloomberg Green Docs competition. Coming up, finding investing opportunities in climate change.
You cannot be a tourist in climate. You can't just sort of pop in and think you know the answer. This is an immensely complicated revolution that we're going through. I don't think I have to tell this room because you're here, but we have to encourage people to do the work and not simply fall back on how things are done now.
Up-to-the-minute news whenever and wherever it happens. I'm Romaine Bostick in Detroit, and this is Bloomberg.
If you look at private equity just as one piece of the institutional equity market, there are 3 times as many dollars invested than uninvested, right? So you have about $3.5 trillion in the ground that needs to get resolved versus about $1.5 trillion that's wanting to be invested. So if you're a private equity manager, you're trying to decide, do I take my capital and put it into my existing portfolio to either defend what I own or to try to grow it and create more value? Or do I use some, to your point, some creative financing to extend the duration or the runway of what I own and then try to put the capital into the new market environment? And everyone's taking a different approach. It's a function of where you are in your life cycle. Everyone is dealing with that. Even the highest performing PE firms, you're seeing slower fundraising. And in this deal environment, you have to start thinking creatively about how to get liquidity back to your investors.
Good morning. This is Bloomberg Surveillance.
Welcome back to the opening trade.
This is Bloomberg Technology.
This is the Asia Trade.
This is Wall Street Week. Welcome to Balance of Power.
This is Bloomberg.
Welcome back. I'm Carol Masser. The Bloomberg Green Festival is in Seattle because of the city's impressive legacy of environmental leadership. This city has focused on building a clean energy economy and in investing in healthy, well-connected communities. Let's get inside to the main event stage. Bloomberg's Jason Kelly with TPG Executive Chairman Jim Coulter.
We're about to undertake a $120 trillion reindustrialization of the world, and that need and that opportunity need to move together. The money can't come from governments. No coalition of NGOs can get it done. Unless we can get the money moving in a capitalist system, we can't solve the problem. So this idea of putting the need and the opportunity together has been more challenging than I expected. One thing I know from 40 years in business is nothing is linear, and there will be surprises. In fact, we should assume that there's going to be discontinuity. More people died from infections than heart attacks before penicillin. You know, taxis were taxis before Uber. Trading was trading until indexing. So industries constantly go through disruptions. As I travel the client world, I'm running into disruptions that are about to happen at any time. I can't yet tell you which will happen, but I would bet on the field. There are going to be discontinuities that break our way. Our goal is to position for them. The second thing I'd point out on the green shoot side is understand the power of cost curves. Think about cell phones. In about 2000, they hit a whole new level, and suddenly they were ubiquitous. It changed how video conferencing came out in 1964, but it was $5,300 an hour. When it's free, things work very differently. In the climate world, you are watching some of the most powerful industrial cost curves I've ever seen. 28% for solar, that is double a normal industry. And these cost curves, while they look linear, they hit points, like right about now when solar becomes dramatically cheaper, things happen. We can predict the cost curves, we can't predict how the market change.
So then why that word cloud of pessimism?
Well, I think in some ways, the voices that got us to this key moment have been calling out the need. And part of the reason I'm on the stage, I don't do many conferences, is we need to change our voices a little. We need to also make sure that we're looking for that opportunity. And we're looking for Colin Powell once said about leadership is that optimism is a force multiplier. We have to find a little bit of optimism. That is not to deny that this is tough. And the last thing on optimism is, you know, when things like this conference happen where you get many parts of society, policy members, activists working together, things happen.
Yeah.
Anyone remember the population bomb? 30 printings back in 1968. We were going to be out of food. Los Angeles, the smog was awful. I was in Beijing 3 weeks ago. The skies were clear. The ozone layer is actually going the other way now. With time and with action, I think we can make progress. And that green shoots are something we need to grab a hold of.
All right, so I'm going to go counter then for my next for my next question, which is the whataboutisms.
Yeah, and we also, as well as some optimism, we have to basically not fall for whataboutism.
Yeah.
And you know, one of the interesting things that's happened, if you look online and at social media, the attacks of climate deniers have flattened, but the attacks on climate solutions have gone up. And these are whataboutisms. Now, whataboutisms is a term that came from the 70s with the Irish Republican Army. Whenever they would do something, they'd say, what about the British soldiers? And Soviet propaganda uses whataboutisms. When Chernobyl hits, it's what about 3 Mile Island? So my point here is, as we're going down this path, we have to make sure that we don't get caught in the whataboutisms. And I always say, like, you know, what about doing the work? Yeah. And what about solving the problem? You have to understand what we're doing is a simplification problem. I want you to think about our current energy system. You want to turn on a light. How does that work? Well, first of all, 50 million years ago, the sun shines. It's captured in a tree. The tree falls down. For 50 million years, it gets subsumed under thousands of feet. We then take an iron pipe. We put it down 10,000 feet. We turn it right. We put in water, gas turbine, processing plant. We put it in 3 million miles of pipe again. We put it to $1 billion gas turbine. We basically blow it up, releasing a molecule that can destroy the world, and we have an electron. The other way to do that is we can get sun from this afternoon, hit a silicon panel. There's silicon everywhere, and we have an electron.
Yeah.
So it seems hard to do. I mean, this is hard to do, but what we're doing is hard.
Yeah.
So, like, why not make it a little more simple?
Given everything that you've just told us, what does this room do?
I think importantly, we need to take a bias to action and a touch of optimism. So one of the things that happens in a relay race is the last leg is sometimes the fastest. And what's surprised people historically is when you look at the time, I mean, after 30 years of the atomic revolution, Oppenheimer stepped in and won a war, won 7 Oscars, right? It's like, so I think there's an optimism here that we can get this moving. We may not be moving fast enough, but we are moving faster. And the path to progress and perfection starts with progress.
Right.
And I see that, I think that's happening, and the passing of the baton will accelerate it. So let's have some hope.
TPG Executive Chairman Jim Coulter. Also on the green stage, a business leader whose career focus has been helping to preserve the environment.
Businesses don't hate regulations, they hate uncertainty. That is the killer of business. If I'm making an investment that is going to last for 50 years or 30 years, I want to make sure that I'm going to be able to get a return on that investment and the rules aren't going to change. And, you know, I worked in the oil industry early in my career. I worked as a banker with many companies in the natural resource sector. I'm on the boards of companies now, and they don't mind playing by the rules. They can't have rules that keep changing back and forth. And I'll give you a good example. We worked really hard with governors and wildlife agencies from 11 western states, 7 core states, on the protection of habitat called the sagebrush sea. And Republican governors, Democratic governors, administrations from all political stripes working together to say, how do we do this? Because the governors did not want to lose control of their ability to develop, okay? Because of their hard work to protect these landscapes, the Fish and Wildlife Service said this species does not need to be listed as endangered, okay? When that happened, the oil companies and everything heaved a sigh of relief because they had the rule book and they knew where they could develop or put transmission lines in or other things. They knew what they had to do and the areas they had to avoid. When Trump came into office and Ryan Zinke was in his brief tenure in the position that I used to hold, he said he was going to undo those rules. The very Republican governor of Wyoming, Matt Mead, who worked hard with us on this, went to the Trump administration and said, please don't. The oil companies are coming to me saying, oh no, don't reopen this. We have a deal. And the Trump administration tried to undermine it anyway. They had not been successful, at least at that point, but the oil companies are coming to the Republican governor saying, no, 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 we had a deal. We knew the rule book. And that's a good illustration. So businesses hate chaos. They need predictability.
Former Interior Secretary Sally Jewell. Up next, the man who has done more for electric cars around the world than Elon Musk. AI, how it has penetrated pretty much all sectors, including music. AI can write music, compose music. How do you see AI changing the landscape in fashion?
Yeah, AI definitely helped. When I did the jewelry, I used the AI, helping me to give some idea, but ultimately, you still have to do a lot of it. They just give you very superficial ideas, and but at the end, you still have to customize and have to really make it and do that. I do not think that AI and the technology can replace the human mind at this moment.
Are you concerned one day we won't be able to differentiate designs by AI and designs by an actual designer?
I don't know. For me, I see that, when they decided doing, it's the spirit, it's the heart that the computer don't have.
From the world of politics to the world of business, Joe Matthew and Keely Lines deliver news, insight, and analysis live 2 times a day every trading day. Balance of Power at 1 and 5 Eastern, only on Bloomberg.
The Bloomberg Green Festival shared the stage with TED Talks in Seattle. Let's join Bloomberg senior reporter Akshat Radhi.
I was at a climate protest, and I saw a poster that said in big letters, "Burn capitalism, not coal." Now, how many of you agree that to tackle climate change, we should stop burning coal? Raise your hands. Almost all of you. And how many of you agree that to tackle climate change, we should burn capitalism? There are a few hands, but not as many. I'm a journalist and I write about climate solutions. And when I ask this question of people, I get the full range of answers. From those who say that the system that got us into this mess can never get us out of it, to those who say that the only answer is to unleash market forces for the innovations we need. But who is right? I wanted to find the answer for myself. So I started on the rooftop of my childhood home in India. I wanted to get solar panels for my parents. It took 2 days to get quotes, 2 weeks to have those shiny devices up on the roof, ready to capture the sun's energy. The payback was quick. Electricity bills fell, and my parents have recovered the investment in 5 years. For the next 15 years, they can enjoy solar power for free. So, what has capitalism got to do with it? Well, India did not invent the technologies that go into solar panels. Even today, India manufactures only a small fraction of what it deploys. And yet, a country with less than $3,000 of income per person per year is able to benefit from what is now one of the world's cheapest sources of energy. This has happened because profit-seeking companies want to sell all of us more and more solar panels. But it has happened because governments created that market through subsidies and regulations. Now, the primary motivation to deploy these solutions does not have to be tackling climate change. Other pressing issues such as air pollution or energy security or global competitiveness can garner even more support. How exactly? Let me tell you the story of Wan Gang. You've probably never heard of him, but he has done more for the global rise of electric cars than Elon Musk. Wan was born in China. He trained as an auto engineer before moving to Germany and working for Audi. There he saw the lifestyle that Germans lived and realized that perhaps Chinese people may never be able to experience it. That's because in 2000, China burned about 1 barrel of oil per person per year. Germans burned 12 times as much. So he made the case to the Chinese leadership that the country needed to work on an alternative and that he was willing to lead the charge. So he was given a chance to work on a government program. Wan's team, in a period of 8 years, built hundreds of electric cars and buses that were used at the Beijing Olympics. In those same 8 years, the country's oil bill ballooned and its cities became globally infamous for air pollution. But Wan had shown that an alternative could work. If China could scale the manufacturing of electric cars, air pollution would be cut, oil imports would be cut, and most importantly, China would create a new industry that could compete with other countries. So Juan was made the science minister, and the government started giving out tens of billions of dollars in subsidies for the manufacturing of electric cars and lithium-ion batteries. The government also started putting regulations to make it harder to buy fossil fuel cars. Even today, if you're in Shanghai and you want to buy a gasoline-powered car, you have to enter a lottery and win it. If you want an electric car, you can just go to a showroom and buy one. The Chinese government provided direction, but it was the practitioners of capitalism that made a small electric car industry into the global giant that it is today. One of those investors was Warren Buffett. He invested in a little-known company then called BYD. Today, BYD sells more electric cars than Tesla. For climate capitalism to work, governments and businesses need to be flexible. They need to recognize when there are policies that require certainty, but if they're not working, then they must be changed. Governments need to work with business to figure out what are the regulations that would work.
That's Akshat Reddy. We also heard from a campaign voting guru on how to get candidates to prioritize long-term climate issues. Here's Nathaniel Stinnett.
I've worked in politics for over 20 years, and one of the biggest barriers we face when addressing the climate crisis is a lack of political will to enact all the climate solutions that we already have. Whether it's energy permitting, pollution regulation, tax codes, building codes, you name it. The reason so little is getting done is often because it's easier to win elections by ignoring the climate crisis rather than addressing it. The problem is this: we don't have enough climate voters in the United States, and that's largely because millions of environmentalists don't bother to vote. When we look back at exit polling data from the 2020 presidential election, ultimately only 4% of voters listed climate change as their top priority. 22 midterm polls showed the same thing, 4%. And when so few voters prioritize climate change, two really important things start happening. First, it becomes incredibly hard to elect climate leaders. But second, even when climate leaders do win elections, it isn't like they can then just snap their fingers and get everything they want done. No, they still need to pick and choose what to spend their political capital on, and they ain't gonna spend it on the thing that only 4% of voters list as a top priority. And here's the final reason why this lack of voter demand for climate leadership is so problematic. Politicians know whether you vote or not. That's right. Who you vote for is secret. But whether you vote or not, in the United States, that's public record. And with limited time and limited money, the most important decision any political campaign makes is who to talk to and who to ignore. And when you literally have public voter files that tell you by name and street address which people have a history of voting in the election you're trying to win, well, who do you think political campaigns talk to? Likely voters. And who do you think they poll to figure out what issues to prioritize? Likely voters.
All the TED Talks from Seattle will be released soon on TED's own website at TED.com. Coming up, more from the Bloomberg Green Festival in Seattle.
How do you think about what you guys need to do at Amazon in terms of the next generation?
Yeah, I think increasingly this next generation, they both care a lot, they're incredibly passionate, and they have a lot of anxiety about what's coming and what the state of the world is.
geopolitical news whenever and wherever it happens. I'm David Gura at the G20 Summit in Rio de Janeiro, Brazil, and this is Bloomberg.
The top names in business are on Bloomberg.
The IRA was I think a legislation that was focused on carbon intensity, the right way to drive emissions reductions, and so we responded to that to demonstrate there are ways to continue to provide affordable energy and reduce emissions. How quickly do we want to advance those? Obviously, we need the regulations to come out of the administration. Even the Biden administration today hasn't fully translated the IRA into effective regulation.
Nobody covers business like Bloomberg.
There is this real momentum from Wall Street.
We are basically deep in the European earnings season.
Take a look at how we're faring when it comes to Asian markets.
As you've seen, the Bloomberg Green Festival brought together innovators, policymakers, and activists. I got the chance to speak with two leaders with very different backgrounds who have shared goals. Here's WNBA legend Sue Bird and Amazon's Kara Hurst.
We want to send these really strong demand signals, and we want to also put our own resources towards that. So we've been doing things like purchasing renewable energy. We're the largest corporate purchaser of renewable energy in the world. We have been for the last 4 years. We announced yesterday we've actually hit 100% renewable energy across our global operations, which is a huge feat. We have over 500 projects.
Yeah, exactly.
Around the world. We've got 24,000 electric delivery vehicles on the road already. We've got one of the world's largest electric charging infrastructure kind of operations going. We've just got, we look at all the different aspects of our operations and think about how do we make it more sustainable on behalf of our customer. We want to reduce waste. We took out those plastic air pillows. We took out 95% of those in North America. So we want to make a sustainable company and do it on behalf of our customer.
Sue, I want to bring you into it. You are part of a group of very elite athletes. And when we use the word legendary, it doesn't apply to everybody, but it definitely applies to you. So kudos. That platform, though, has been a couple of decades in the making and then some. How do you think about your platform and the responsibility of how you use it?
Yeah, women's sports is at an interesting moment, especially women's basketball. And for
a good interesting, right?
Yeah, no, great interesting, great interesting. But what's interesting about it, maybe in a negative sense, is while the coverage has increased, what I've noticed is it's not always accurate. And it's really had me take a step back and be like, first of all, what else is inaccurate out there being told to us, by trusted, places, other trusted platforms. So I think for me, when it comes to my platform, for so long while I was playing, it was about, bring a certain understanding to the game, right? Using my platform for all kinds of good. Now I'm like, wait a minute, I gotta make sure the stories that are being told are accurate. I gotta make sure that when people are tuning into a game, they have a full understanding. So that's really where I feel like I can use my platform now as a retired player.
I want to talk a little bit about the climate pledge. So I'm curious, Kara, when you have conversations with companies, what is it? Is it tough to get them to sign on, or tell us kind of the environment here?
Yeah, I think it's a huge commitment to sign on, and it certainly takes resources. And so I think it takes a leap of faith, too. Not all of us know how we're going to get there. There are some things we know how to do, like electrifying fleet, and then there are other things like aviation, where we know sustainable aviation fuel is part of it, but we don't know all of the solves. And so some of it is a bit of jumping into the fray and saying, we know some of how we're going to get there, and also we need to partner to figure out some of the other ways which we don't necessarily know. And we need to change the game, right? So we need to figure out how we're going to come together and make new decisions together, put resources together, and also public-private partnerships are a big part of it. So how do we come together and work in the cities where we all have employees or we have operations, and get cities to change their infrastructure, and build differently the buildings that we're in, or put more rail in, or change our, the ways in which people commute, and those kind of things as well.
Well, how do you think about what you guys need to do at Amazon in terms of the next generation?
Yeah, I think increasingly this next generation, they both care a lot, they're incredibly passionate, and they have a lot of anxiety about what's coming and what the state of the world is. And so one of the things I think is our responsibility is, one, to act fast, to drive big solutions, but also to bring some optimism to it. We have time. We don't have a lot of time. We're in this decisive decade where we have to act now.
Right.
We have to move very quickly. And so I think one of the things that we need to lead on is to show that there are solutions, but we need to deploy them now. We cannot wait any longer.
Amazon's Kara Hurst. That's it from the Bloomberg Green Festival in Seattle. Whether you run a business or a household, lead a nonprofit, or work with your community group, you can find stories that matter to you at Bloomberg.com. I'm Carol Masser.
Week on Wall Street Week for stories of capitalism from business, markets, economics, tech, and climate. More than what you need to know, it's what you need to think about.
European countries need to think, do you want to compete as a small country or do you want to compete as Europe? I don't think they have a choice because the US and China have already started the race. And Europe needs to follow. There isn't a European company in the top 20 largest firms in the world. That is a problem.
But what does it mean for individual countries within Europe?
You can have more control and less growth, or you can have less control and more growth. If countries trust each other more and they build more European champions rather than each country having its own national champion, growth is going to be better, productivity growth is going to be better, the welfare is going to be better. But there is going to be less control at the national level. So right now, each European country wants to have its own telecom company, its own couple of large banks,
Its own bank,
its own large energy companies. And the question is, are you willing to surrender some of this control to European firms, which are going to be more productive, but you are going to have less control at the national level?
Bloomberg Surveillance covers the latest in global markets and the political events that influence your world. Join Jonathan Farrell